the chairperson of the Ministerial Advisory Committee on Social Behavior Change. Let me recognize the minister. As I've said, he has already joined the meeting. There are members of the advisory committee who are here, as well as members from various committee and civil society in all its diversity. I don't want to waste time because I know we will capture a summary of various organizations that have joined this conversation. I think one of the key things in our engagement is to be frank, to be open, to be honest, and really to clarify some of the issues that we've had around meaningful engagement with civil society, and some of the recommendations we want to bring forward, that speaks to the role of civil society and how civil society have strongly contributed in the past, and how civil society strongly contributes and continue to contribute today. There are various civil society formations with expertise, with knowledge, but also with the power of making the change that we want to be seeing. We are quite grateful, of course, of the work government has undertaken since the announcement of the first incident of COVID or reported case of COVID in South Africa. And I think we are in a very critical time where, in our second wave, as part of this global pandemic that we are all fighting, of a second strain, but as well as the variant that has been announced in the last few weeks. We're also in a critical time where we're seeing announcement. We've heard announcement on the vaccination program by our government. And I think critically so, it's about how we advance, how we listen, how we advocate and influence some of the policy changes or programmatic changes that we want to be seeing as civil society. I look forward to this discussion, and I'm really quite excited with the opportunity of opening up the space, which we're going to be doing as frequently, and that we don't limit it to some of the structures or committees that have been set up. And I know I'm putting Bishop Mpumlwane in terms of a commitment that we might even have to ensure that we facilitate this more broader civil society that can guide us as a collective. I think the theme of this conversation, it's really about collective action, collective effort, and responsibility for that matter. And we really are looking forward to this engagement that will help us take the work forward as a collective in assisting with the pandemic. Without any waste of time, let me request Bishop Mpumlwane to give us opening remarks. Thanks. Can Bishop be unmuted? Go ahead, Bishop.
Thank you very much. Good evening. I recognize that the Minister of Social Development is in the meeting, and I also recognize that Deputy Minister of Health is also in the meeting. And the Minister of Social Development, Ms. Lindiwe Zulu, Minister of Health, Dr. Zweli Mkhize, Deputy Minister of Health, leaders and representatives of civil society organizations, members of the multi-sectoral Ministerial Advisory Committee for Social Behavior Change, officials of the Departments of Health and Social Development. Good evening, all. My name is Malusi Mpumlwane. I have the privilege of speaking to you tonight in my capacity as the chair of the Ministerial Advisory Committee that was created in June by the two ministers who are to address us tonight. Before I say why it is important that we meet here tonight, let me say a little about what this MEC is about. It is made up of women and men invited in their individual capacities to collectively advise on those measures of necessary social behavior change that may help us mitigate the spread of the coronavirus, and what government can do to help South Africans better respond to the demands of this troubled time. The MEC is primarily designed as an advisory to the ministers and not as a voice or activist body in society, even though each of us are activists in our own right. But with the onset of the second wave and the serious threat that unless extraordinary measures are taken, we shall see the dark of winter in the turbulent waves of the third wave, such as is currently raging in Europe. In this context, we said to the ministers, we're not the types who quietly sit by and watch. We are activists who are part of a broad community of organizations that variously stand for and advocate for the best of South African values for public good. It is to this body of organizations that we shall seek to draw energies to cultivate the manner of being differently cultured for survival as a nation. Our survival is not just a matter of government. It is a matter of each and every household in our society. We believe that it has to be the people that our organizations serve who need to increasingly appreciate and own the campaign to wear the mask, to keep the distance, to maintain hand hygiene, and treasure ventilation.
Bishop Pumbulwana has muted by mistake.
Well, I don't know at what point that happened, but I'll just say that our survival is not just a matter of government. It is a matter of each and every household in our society. We believe that it has to be the people that our organizations serve who need to increasingly appreciate and to own the campaign to wear the mask, to keep distance, to maintain hand hygiene, and treasure ventilation. For the long term, it is our population that needs to recognize the need for population-wide immunity that can be occasioned by the nationwide vaccination that must roll out aggressively in order to save lives. Now, against this background, the MEC has chosen the unusual step to take the responsibility to convene civil society organizations and invite the ministers to brief us and have us consider what each of our organizations can do to contribute, each in our own way, to the purpose of saving the lives of South Africans. Friends, to put it bluntly, who are here tonight to recruit amongst you and your organizations a cadre of champion organizations and individuals for COVID combat, with a rallying call that says, COVID-19, our collective challenge, our collective responsibility. To do that, we need the Minister of Health, Dr. Mkhize, to level with us and give us a good briefing of the current status. We need the Minister of Social Development, Ms. Lindiwe Zulu, to give us a sense of how she sees the role we can play. We have also taken the liberty to invite a couple of examples of what is possible as a contribution. These will be given on a show and tell basis. But now, let us be informed. Mr. Minister, please talk to us.
Thank you very much, Bishop Pumbulwana, Chair of the Ministerial Advisory Committee on Social Behavioral Change, Steve Litsike, the Chairperson of the meeting and the co-chair of the SANAC, Minister Lindiwe Zulu, Minister for Social Development, the Directors General of Department of Health and the Department of Social Development, colleagues, leaders of various organizations, and social partners, good evening. We have been very pleased to get the opportunity to meet this evening. I know some of you might have been short notice, but what has been important to us is that it's a very, very important conversation that we're having today. My conversation is going to constitute of a few remarks, and thereafter we're going to have the Director General taking us through a presentation, which is a briefing. And then, of course, our Minister Zulu, will also give her address. And that will lay foundation for the discussion. Let me thank Bishop and Steve and the other members of the advisory committee for having gone out of their way to organize this very important platform. We have all been aware of the challenge of the COVID-19 that is currently raging on the second wave. What has been a challenge to all of us is that the COVID situation is a problem that the whole world is facing almost at the same time, with our country also following on the pattern of how the COVID-19 has behaved in various countries. It's become very clear to all of us that two main issues need to be focused upon. One is the issue of containment measures that will help us to prevent the infection, the use of mass sanitation, hand washing, etc. And then on the other hand is the issue of vaccinations. In between, our health services have to manage those who are infected, but our best bet is to be able to focus on how to avoid the infection to set in the first instance. We are now, unfortunately, all in the same stampede with the whole world to look for support in the availability of vaccines. And therefore, it's important for us to understand that whatever challenges we see are faced by the different parts of the world, insofar as the issues that relate to the vaccines are concerned. This current resurgence, as we have moved around throughout the whole country, it is clear that we might be starting to see an inflection, and we credit that to the whole determination with which our people have actually gone back to the use of masks and the use of sanitizers and ensuring that they keep a distance. We're still finding a lot of areas where these are not possible, but we also are aware that over the period, there has been the festive season that really exacerbated this situation. And if you look at our numbers, you'll actually see that it is related, particularly in Gauteng, KwaZulu-Natal, in Limpopo, and partly Western Cape, to the activities that are all associated with the fact that with our festive season, we're all generally more relaxed and tend to be found in overcrowded situations where everyone is enjoying themselves. And this was associated with a degree of complacency that we had to request that the public need to take very seriously, and as we also put up additional restrictions. This Ministerial Advisory Committee was set up in order to advise government, particularly in terms of what needs to be done, what messages can we put in place to go out to the communities to help them to understand the messaging, but to also, the understanding must result in the change of behavior so that we can behave in a way that reduces the risk to the COVID-19 infection. We have now at this point lost over 37,000 people who are associated with the COVID-19 situation. And we have also seen about 51,000 healthcare workers who have actually tested positive, with almost just under 600 that have lost their lives. It is quite clear to us that we need a very strong and aggressive campaign, that whilst we're battling this current surge, we now need to get very strongly on the campaign to promote behavioral change and the promotion of the vaccination program. We're at a point, therefore, that we're going to brief you that we are in the process of procuring a large number of vaccines, and we've put up a plan, a plan that's going to help us to reach out to the various categories of society where we need to focus on to start the vaccination, starting with the health workers, and of course focusing on all the frontline workers and all those who are working in close proximity with large numbers of community, and then on those with comorbidities, and then of course reach out to the rest of the South Africans. We've taken this approach on the advice of another Ministerial Advisory Committee on COVID-19 vaccine, because it's believed that as the numbers of vaccines are going to be coming on an incremental basis, we need to then be targeting who we are able to reach to first, particularly to protect our health workers, and then of course protect all those frontline workers. But the aim at the end is to achieve what we call herd immunity, which means those, the majority of our people must have vaccine-acquired immunity that will help us to be able to avoid further spread of infection, to protect those who could be vulnerable, who may not have been immunized, etc. So that process, we believe, is on course, but part of it having to be on course is how we have to work together with civil society, with labor, with business, working together with government to send one common message about the need, the desirability of the vaccines, helping to clear a lot of myths, as well as also helping us to organize society in such a way that all our available vaccines are put to the targeted use until we're able to reach to everyone. Most of the countries in the world are looking at 2021 as a period during which vaccination have to be administered, and we are also within that kind of process. In the meantime, we have been aware that some of the well-to-do countries have actually hoarded a huge amount of vaccines, some ordering 4, 5, 6, 10 times the population sizes. Of course, we are not in a position to be able to do that, but at this point, we have actually got such fruitful engagement that we would be able to provide as much of the vaccine that is needed, and we'll be making announcements as soon as all of those agreements are concluded and we're able to go public about them. But whilst we're going through this process, all we can indicate is that our targeted date for the first set of vaccines to come through is around February, is January, and then the starting of the vaccination would be in February. Then we'll move in various phases, which our presentation is going to indicate, so that at the end of the day, we're able to reach out to a total of about 40 million people that must be vaccinated. So with that in mind, we therefore need to request your support. Firstly, in the spread of information of what the issues are with the vaccine. Secondly, in terms of feedback of the concerns that you are coming across as you deal with the issues of vaccine, COVID-19, and related matters, so that we can work together to try and resolve those challenges. Other than the HIV program, this is probably one of the major programs that we have undertaken to improve the health of our population, wherein we have to vaccinate almost 40 million people within a very short space of time. So we need your support in going out there to help us deal with the information that your constituencies might need, so that we've got the same set of information. We are able to deal with some of the myths and the misconceptions and the fears and the anxiety about the vaccine. We also deal with the inefficiencies of the system and the distribution of vaccine. We also deal with suggestions of what else needs to be done to deal with this process of rolling out the vaccines. I therefore want to say at this point, if I could just request that Dr. Buthelezi takes us through the presentation, so we can at least have the same kind of information that has been shared with various platforms. We have had meetings with unions, we've had meetings with business, we've had meetings with traditional leaders. All of these have actually been about how best we can create the partnership so that government, which is going to procure all these vaccines, working with the support from the private sector and medical aid, can actually have a process wherein all the sectors are able to participate in the coordination, the oversight, so that ultimately the program must be more effective on the ground. That is really more our focus on this, and if we can get Dr. Buthelezi to give us a presentation, and then we'll have ministers to come in afterward. Thank you very much. Dr. Buthelezi, if you could start sharing your slides.
Thank you very much, Minister. May I request the host to enable me to screen share? It's saying I'm disabled to share the screen. May the host please allow me the rights to share the screen?
Sure. Good evening, Dr. Buthelezi. You're allowed to now.
Thank you very much, Minister Kabazela, Minister Ndabezitho Makeba, the chairperson of the meeting, Comrade Steve, the chairperson of the Ministerial Advisory Committee, Bishop Mpumlwana, my colleague, Director General from the Department of Social Development, Makingwane, all the members of the MEC, my colleagues, fellow South Africans, good evening. The Minister has actually summarized my presentation, so I'm not going to spend much more time going through the presentation, but I'll cover the areas that I think are very critical. My presentation will cover three main issues. We'd just like to touch a bit on epidemiological trends, just to see where we are as compared to where we were probably in the first wave. And then we'll then spend a bit of more time on the rollout of the vaccine. And then there's quite a lot of noise about the use of ivermectin for management of COVID-19 in the media, in the social circles. So we thought that we must touch a bit on that so that the South Africans could be aware of what's happening with the drug and where we are as a country. In terms of the epidemiological trends, this one gives us data that we had yesterday in terms of where we were with the infections. And what we can see here actually is that we're now sitting at more than 1,144,857 new infections. And then active cases are at 173,000. And the deaths, sadly, we're now approaching 40,000 in terms of the new deaths. If we then move on to look at this graph, which is developed using data from NICD, and it's been synthesized for us by Caprisa. If we look at the dark line in terms of the new, in terms of the new cases, we can see that in the second wave, we long surpassed the peak that we reached in the first wave. That is a dark line. Also with the hospital admissions, if you look at the gray, the shaded gray, which is hospital admissions, similarly in the second wave, the hospital admissions surpassed the peak that we reached. And sadly so as well is the mortality, which is the red line, which shows that even the mortality, the people that demised, we also actually went above the peak of the deaths that we had in the first wave. But as you can see, ministers, here then we've started to see the decline, both in the new cases and also both in the hospital admissions as well as also the deaths are starting to now go down. And we pray that this trend continues. We've started seeing cases less than 10,000. We're moving from where we're actually at around 21,000 new cases. So we've now have those cases. So it looks like we have turned the corner. Let's pray, and we also hope that the responses the minister has said from the South Africans is actually working, but also the lockdown looks like it's actually helping us. Looking at this slide, I would really like you just to focus. We're looking at a week of 5 to 11 January, and then the week of 12 to 18 January. And I would then like you just to only focus on the last column, which looks at the decrease, increase or decrease. Actually, all the provinces are now starting to see a decline in new infections, with the exception of 2 provinces, which is the Northern Cape and the Free State. The largest decline is actually in Gauteng and followed by KZN. These are the trends that we're monitoring, but overall, on average, the whole country, the decline is just above 25% in terms of the new cases. Now, if we go to each of the provinces, now in a graph form, we can actually look here. We can see that most of the provinces, they surpassed the first peak, but we can see all the provinces are now starting to show the decline, except those marginal increases in the Free State and Northern Cape, as mentioned. I will stop there on the epidemiology and now move on to update on vaccine rollout planning. The vaccine rollout planning in terms of the framework is it's actually aligned to the WHO a framework of rolling out vaccine, looking at the overall governance, how you deal with that, communication, stakeholder guidance and training, and then coming to the whole chain of community or population prioritization, the allocation of vaccine, distribution to the point of use, administration, and then post-administration in terms of safety, effectiveness, uptake, and also ensuring that people come for a second dose for those vaccines that are 2-dose vaccines, then monitoring the supply, and then we track that, looking at the uptake as well. But critically, then there are issues of regulatory considerations. We'll talk about all these issues. So our planning is based on this framework. And then lastly, of course, we need to have the money to pay for the vaccine, and also all the ancillary issues that go with the administration of the vaccine. The minister has spoken about the aim of the vaccination, what we're trying to achieve, and has spoken about herd immunity, or what is called population immunity. There are key issues that we want to touch on, which is firstly, the South African government national level will be the sole purchaser of the vaccine. The National Department of Health will contract with suppliers to purchase stock and allocate to the provinces, plus the private sector. Of course, with the private sector, there will be some mechanisms for cost recovery in terms of being able to pay for that. Now, given the multiple issues that the minister mentioned, we won't have all the doses at the same time. Hence, the stock available, we will need to manage it properly and do some prioritization. But what's critical is that some of the vaccines, I will talk about them, are 2-dose vaccines. So if you've had the first dose of a Pfizer vaccine, you can't have a second dose of an AstraZeneca vaccine. So you'll have to have the same vaccine that you had for the first. So it's not interchangeable. And then, as mentioned, the allocation of vaccine in terms of priority groups, we are guided here by the Ministerial Advisory Committee on Vaccines. And also the vaccination system will be based on a pre-vaccination registration and an appointment system that we are putting in place. And then all vaccinated persons should be on a national register, and we will be providing a vaccination card, which may be electronic for those who probably will have the smartphones. So we're working on all those areas. Why is this important? You will all know that if you're traveling to countries, most of the countries, they want you to produce a yellow fever card to show that you are vaccinated against yellow fever. Similarly, we will be doing the same. And we also show that most of the countries will want you to show them that you are vaccinated against COVID if you want to travel or you want to get a visa to their own countries. So we must have some documentary proof that will show that someone is actually vaccinated. In terms of leadership and coordination, as you will notice, the president did announce yesterday at the highest level in terms of political oversight, an interministerial committee on vaccination has been put together to actually guide and oversee the whole process at a cabinet level. And then we do have at a scientific level, the Ministerial Advisory Committee, which is chaired by Professor Shup, Professor Madosun Pumlwana, he does sit on this committee, and Professor Slim Abdul Karim, who chairs the other Ministerial Advisory Committee, they sit here as actually observers to ensure that there is alignment in terms of the work of the 3 committees. And then the MEC on Social and Behavior Change that has brought us together here today, chaired by by Bishop Mpumlwana. will actually assist us to drive a concerted social mobilization campaign to all the sectors, but also guide us on some of social behavior issues that we need to actually take care of as we are moving on with the vaccine. Then we have a National Vaccine Coordinating Committee, which is at a National Department of Health, which I chair. And then it's got all provincial heads of departments, it's got the private health sector representatives, and we do have a slot for the civil society representatives, which must be decided on, and also the unions as well. And then there is the private sector coordinating committee, which is actually mainly pulled together by Business for South Africa, the Black Business Council, and all other formations are actually part of that committee to ensure that there's coordination as well from the private healthcare sector. In terms of the identification of the priority population groups, the MEC on vaccines has guided us on this one. And basically the key principles is that we're looking at, it's not that some people are more important than the other people, but we're looking at starting with those that are essential for the societal functioning, the groups that are most at risk, and those that are most at risk of transmitting to others. So that's how the prioritization has been done. And these are the phases as the minister went through. Phase one, looking at healthcare workers, both in the public and private sector. And here we're talking about healthcare workers, not only based on the ranks or on the qualifications, but any person who works within a health facility. And then phase two, we're then looking at the other essential workers. Then here we're looking at the teachers, police, army, and others. But you will note that within the army, we've got South African Military Health Services, which falls under healthcare workers. You also know that with correctional services, we have correctional service officers, but we also have healthcare workers within there who will then fall under the first category. Now, the first category, I must just stress, it includes the community health workers who are very critical in the work of government. Then the elderly and the people with comorbidities, they actually fall under phase two. Then phase three, then we look at the other population of people more than 18 years of age. We've said 18 years because there's still a lot of work to be done on people younger than 18 years in terms of the vaccine. Most of the trials were done on people above 18 years of age. Then we have then also then looked at the healthcare workers themselves, because we want to just start with everyone. Even within the healthcare workers, we will start with those who are in contact with patients and those who are not in contact with patients. Now, these then the provinces were working with them. For example, the clinical staff that are dealing with the files and registering the patients, those people are actually in contact with the patients. So we should not only think of clinical staff when we're talking about this. The porters or the orderlies, including the cleaners in the wards, all those people are actually in contact with the patients. So we are going right across the board when we're defining the healthcare workers. Then I've mentioned the essential workers, including people working in the funeral parlors. So I'm not going to spend time on this one. That will be phase two. Then we'll go to phase three. Now, in terms of vaccine selection, there are key considerations. The first one, of course, is bullet number 2, is that it must have gone through the clinical trials, must be safe, efficacious, and must be able to actually elicit immunogenicity. The second one, because of what is happening, as the minister has mentioned, is the supply. Where we are now, we're looking at who can give us the vaccine first. Then ease of use, storage and distribution, the cost is very important. And of course, regulatory issues in terms of SAPRA, which is South African Health Products Regulatory Authority, that actually certifies all drugs or medicines that and also the devices that we use here in South Africa in terms of the. Then in terms of the vaccines that we are working with now, that we've had discussions with, that we've signed things with, it's a Pfizer vaccine, which got emergency use approval by the FDA, and it's being used in a number of countries. It's more than 90% efficacious. The only problem with it is that it needs ultra low temperatures in terms of the cold chain. It needs to be stored at less than -70 degrees Celsius, but it's a good vaccine. The next one is the AstraZeneca, which is the one that we're going to get first here in South Africa, and they've licensed the Serum Institute in India to actually manufacture it. And with this vaccine, the deal is done. We're getting our first shipping end of this month, as the minister mentioned. It's 70% efficacious. It's a 2-dose vaccine. The Pfizer is also a 2-dose vaccine. The third one is a Johnson & Johnson. Again, we've signed with Johnson & Johnson in terms of the term sheets. We're just finalizing the advanced patients agreements with them. We were in discussions with them as late as last night. And then this vaccine is actually going to be manufactured here in South Africa by Aspen in PE. And we're having quite good discussions with them. But the other one is Moderna. Moderna also got emergency use authorization by the FDA. It's a 2-dose vaccine. It also needs a bit of an ultra low temperature at about -20 degrees centigrade. So we are having discussions with them, but there are issues that were not finalized. But just on these, I just wanted to say that we have signed with Johnson & Johnson. We have signed with Pfizer in terms of the term sheets and agreed on the doses. We have also signed with the Serum Institute, which is manufacturing on behalf of AstraZeneca, and we're getting the first delivery end of this month. There are also other vaccines that we are having talks with. We've had meetings under the leadership of the minister with Sinopharm in China, and there are issues that we are busy with. Actually, today they did send a non-disclosure agreement. And we are following up on that. We are also having discussions with the Sputnik vaccine, which is a Russian vaccine. We did have a meeting last week under the leadership of our minister and also the chair of the vaccine advisory committee. So we're quite open in terms of the discussions. We have signed with the COVAX facility, which is a pooled mechanism which is run by Gavi and the WHO and CEPI. So, and Gavi, we already paid the deposit. That's what was on the news. We paid the deposit in December through the Solidarity Fund, and we are waiting for them to give us a delivery schedule and the vaccines. What they do there, they actually do negotiations on behalf of different countries with the different vaccine producers, and then they will allocate us some vaccines. And with the Gavi, we have signed for 6 million people. That means that if they give us a 2-dose vaccine, they'll give us 12 million doses. If they give us a 1-dose vaccine, it will be 6 million doses. Obviously, we'll need to build in wastages when we work on that. And then in terms of regulatory issues, as we know that any medicine that needs to be used in terms of the Act, it has to be registered in South Africa by SAPRA. And SAPRA is an independent institution which actually reviews all applications for clinical trials, for medicines, for medical devices, and then they authorize that. So with SAPRA, for example, some vaccine manufacturers have actually submitted their documents. Pfizer has submitted, Johnson & Johnson has submitted. With the AstraZeneca, we are expecting an approval. Actually, there was a meeting today, so we'll probably be getting the final approval, but we have actually, with the Serum Institute, we've applied for what we call Section 21 authorization, so that we are able to quickly get the vaccine once they actually follow the other process of being fully registered. But when they do this, because these vaccines have already been authorized in other countries, SAPRA has actually MOUs with a number of bodies like the FDA, the MHRA in the UK, the EMA in the European Union, and the TGA in Australia. So they have an agreement that they then use what is called a reliance authorization, looking at the documents that were submitted to these organizations. So this is not going to be an impediment at all in terms of us getting the vaccine in time. At the same time, ensuring that we protect the South Africans by ensuring that the vaccine is safe and effective. In terms of procurement, we're working closely with National Treasury. Of course, it's being guided by the prescripts, the PFMA, and other procurement legislation, and of course, Critical Medicine-Related Substances Act, and of course, under the assistance of Treasury emergency procurement procedures, and we've had to get deviations, for example, to go to the COVAX facility. And as mentioned, that as part of procurement in the country, we can't procure something that does not have clearance from SAPRA. And then in terms of the distribution, we have a distribution network that we've put in together for the healthcare workers in terms of how we're going to do, which is phase 1. Once we get vaccines from the COVAX, how we're going to do that, and how are we going to contract people that will help us with the distribution up to the point of vaccination. We have actually, for the first batch of the vaccine that comes in, we have actually signed an agreement with BioVac. For those of you who might not be aware, BioVac is a vaccine manufacturer and also distributor, which is actually co-owned by government. So that's why it's easier to work with them because we are using existing government capacity to be able to do some of this work. So when the vaccine comes at the airport, then they will be responsible to take over. They do customs clearance. Then they have enough cold chain capacity. They take it to their own storage house. They then distribute to both private sector warehouses and public sector warehouses based on how we actually advise them in terms of the allocations for those different warehouses. In terms of distribution and security, we have to ensure that we have proper security with vehicle tracking and monitoring. We are in negotiations with the security cluster through the net joints and SNDF, the police, to assist us. The tracking of the vaccine using barcode scanning is being used. This will be done such that every person who gets vaccinated, we should be able to record what was the barcode of the vial that was used. Of course, what's more critical also is that we need to ensure that with so much medical waste in terms of the program, we have proper, safe and secure disposal of all the medical waste that comes of this, the verification of the data, and of course, we need to monitor vaccine wastage. Most of these vaccines, they come in multi-dose vials. Some of them, they come in 10-dose vials. So then we need to calculate a 5% or a 10% and see how much wastage we need to expect, because that's very critical when you're dealing with the vaccines to actually factor in the wastages. In terms of healthcare workers, phase 1, we're targeting that most of the healthcare workers will be vaccinated within their place of work, be it in public or private hospitals. And we're also going to ensure that they will also, for smaller health facilities, will have an outreach vaccination program where we'll have actually the mobile teams that will move out into the clinics from the central hospital or be it a district hospital. They move every morning, they target a clinic or a PHC, they vaccinate there, they come back the next day, they do that same issue with the private medical centers and all the other areas. We are also going to develop the vaccination centers where we've had discussions with the pharmacists, the retail pharmacists, and we will also be working with some other areas that are outside of the pharmacies. We've had meetings and we also know the capacity within the major retail pharmacy groups, but also the independent pharmacy groups through the ICPA, which is the Independent Community Pharmacies Association. Then in terms of the human resources, districts and provinces, we had our meeting this morning. They are actually finalizing, and by Friday, they will be submitting final plans in terms of the vaccinators, and they will be mobilizing them from existing staff through their through their wellness clinics if they have additional staff. Our minister has written to the Minister of Defense to actually mobilize South African military health services. I have also written to the health attaché of the US government to actually mobilize all the healthcare workers that are employed through the PEPFAR partners and other organizations to actually participate in terms of vaccination. We are also working on a program of volunteers, but this will finalize very well by on Friday when the provinces submit their final plans to us. Then, of course, it's important that we actually look at the administration, the safety. So this is very critical. We just need to ensure that we've got proper pharmacovigilance to actually follow up and have a reporting system for what we call AEFI, which is adverse events following immunization. And we need to assess, and this must actually be recorded. And SAPRA will be implementing the vaccination card system, and we are adapting that, working with them. But also we are ensuring that all the safety issues are actually followed up and reported accordingly, so that people can have confidence that we're not only interested in vaccinating, we do know that you do get adverse events in terms of vaccines, not only with this vaccine, even with the simple measles vaccine, mumps or diphtheria vaccine, people do actually get adverse events. So we need to cater for this and report it accordingly. Then in terms of data management, we are going to develop an electronic, actually it's very advanced now. It's an electronic vaccination data system, which will assist us to be able to monitor uptake coverage that the prioritized group are getting. It will also help us with planning and ensuring that we are able to order in time. So it will be a leveraging on existing system, including the health patient record system, HPRS, where we have more than 50 million South Africans already registered there. Then these are the types of reports that is going to produce, but critically, we will have a dashboard, a live dashboard where every day we should be able to pick up how many people have been vaccinated and where, so that we are able to report on a daily basis to the public. And then the communication and demand creation strategy, this has been developed just to ensure that there is a coordinated effort, and we'll be working closely with GCIS. But what we are trying to do here is, as the minister was saying, to correct misinformation, to actually address issues of hesitance in the public, provide correct, consistent, and timely information on the vaccines in terms of availability, safety, timelines, and vaccination processes, generating awareness, and also address all the other issues that are actually problematic down there in terms of communication. These are the target groups in terms of the communication strategy. I'm not going to spend much time on that. Then my last area will be to touch a bit on ivermectin, which has been on the media and also in the social circles quite a lot. Ivermectin is a drug which is a host-directed and which has a broad spectrum activity against RNA viruses. What it is currently used for in South Africa is registered for use within agriculture to deal with some specific issues in the veterinary sector, but also off-the-label use. It can be used topically for things like the skin lice, scabies, but it has not been registered as yet for use in humans. So this is what SAPRA released on the 22nd of December, that ivermectin is not indicated nor approved by SAPRA for use in human. There is no confirmatory data that ivermectin can be used for the management of COVID-19. Also, no one has applied to SAPRA to have it trialed, but I must say that yesterday we advised that a group from vets and also from the MRC are actually putting together the work to try and actually do a local trial on ivermectin so that we have some data available locally. There have also been no positive recommendations, even from the FDA, from the EMA and MHRA. The EMA is with the European Union Medicines Association. The EMA MHRA is in the UK. It's just a mirror image of SAPRA in the UK. And as mentioned, WHO does not recommend ivermectin for use in COVID management. So what SAPRA is currently doing, they're actually encouraging the clinicians to actually submit ethically approved trials for so that they are able to get enough data, and they've actually committed themselves that they will actually ensure that they actually fast-track those applications. There are currently a few studies that will be getting some results probably in the next month or so. One is in Egypt, where they've enrolled about 1,370 people. Other one is in Brazil, about 857. One in the US, about 740. One is in Japan, about 240. So SAPRA has actually said that they are also ready to consider controlled access through a Section 21 authorization, provided that such request is supported by evidence for the indication requested and is justified based on the risk-benefit assessment that includes safety and clinical efficacy. Thank you very much, Minister. I think I will stop there and hand back to the Minister. Thank you very much.
Thank you so much, Shenge, and for the presentation. Can I request, I know already we are eager to ask questions, that we actually get intervention from Minister Zulu and immediately go into interaction. There are quite a lot of questions that are posed directly to the Minister, of course, of Health, also relating to the presentation that was made by the Director General, Dr. Buthelezi. So can I rather request just a brief indulgence that we hear Minister Zulu, and immediately we go into discussions from the floor. Over to you, Minister Zulu.
Thank you very much, Steve. I was looking for I was looking for your clan name, but I couldn't find it. So you'll forgive me. Maybe at some point you might be able to share that with me at some point, because I can say Kabazela, Minister, and to the DG, of course, I can say Shenge. So I was trying to find yours, so that there isn't a discrimination from that point of view. I have a bit of a network problem, so if in case the network goes down, I will remove the video, because it's the only way that I can keep properly connected. Firstly, I'd like to thank you, as well as everybody who is in the meeting, in particular Bishop and I didn't find this Dugosake. Maybe he can teach me one day what it is. I also thank the Minister of Health and the DG in particular for giving us that briefing, because I think that briefing is very important for us, as I believe that the connection between ourselves and civil society and interfaith organizations and the public in general, when we get this information, we feel we've got information that we can interact with and be able to clear out some of the perceptions and some of the issues that are being discussed, sometimes with the right information out there, sometimes not with the right information. And therefore, I think this platform for me is a platform that must not happen too much far in between the meetings. So if we can try and be consistent in having these kind of meetings, they give us the opportunity, and probably we could even plan better in terms of our presentation, so that even long before, okay, Mpumlwana Andlanga Mandla Mtolo Zulu. Oh, Zulu too, thank you very much. So we can be able to use this platform if we are consistent in engaging with each other, so that sometimes even the supposedly distance, which is always said there's a distance between government and civil society and all. I think this is one of the platforms, while it is very specific on what it is supposed to deal with, it can be able to bridge the gap between what is out there, what government is doing, and what the private, I mean, when what private what private citizens, NGOs and NPOs can be able to assist, because I saw one question there that was saying, what can NPOs do in support with the work that we are doing here now? And that's a whole discussion on its own, because government, I may say, tries by all means, especially my department, to be close to the NPOs that are dealing with our services, which are related to social development. And I might just throw in the fact that I was surprised when I got to the department to find that my department spends something like 7.6 billion, which has been growing up since from a long time ago, in support of NPOs, and NPOs who I believe are NPOs that should be closer to the people, because if you talk about 7.6 billion and next year we're going to be spending 8 billion, what I am asking the department, and I've been saying to the department, can you come back to me and say, where is that money being spent? Which of the NPOs is this money being spent on? And what is the value of this money? And what is the impact of the work that is done by the NPOs? And the reason why I'm raising this issue in particular is because it should, under normal circumstances, be automatic that my department, health, and a whole range of other departments should be able to use NPOs on the ground. And now that we also have the district development model, it might be very important to check where are these NPOs in the different districts and in what areas are these NPOs working, so that we can really look at how do we deal with this particular issue of behavioral change. Because I believe, Minister Mkhize, you and I and maybe some other ministers that might even join later on, what I think we need to do is to not make this issue of behavioral change and our engagement on what needs to be done in behavioral change to end up being something that we're using only now because there is COVID-19. I think it can go a long way even in the future to try and assist us to deal with the broader behavioral change challenges that our country is facing. And here I'm talking about, at the moment, we are here because we're talking about COVID-19, but there's a whole range of other societal issues that also have an impact in as far as behavioral change is concerned, into how do we help each other to help ourselves with appreciating and understanding COVID-19 and what we need to do. But I also think that behavioral change from the South African context can be able to help us in developing programs that can be very specific about the issues of gender-based violence and femicide and other harmful practices that we have in our country. It is through the behavioral change, through education, educating each other, through helping each other, and through using this particular platform, for instance, to say, how can we assist each other as a nation to journey beyond the issue of COVID-19, but building a better South Africa and building and assisting citizens to be even better citizens. And when I say better citizens, I don't want anyone to think that I'm talking about other people. It includes me too, because I need to also be a better citizen in South Africa. Even if I'm in a political space, I'm a minister, I need to be able to appreciate and understand what are the things that I have to do. Now, I do want to say that part of what is a good thing from a government point of view, these presentations that we are getting here, particularly from the health department, we've been getting these through the net joins and through the NCCC. And in the beginning, a whole lot of focus was a lot on health issues, and it was understandable why we needed to do that in particular. But as the time went on, there was a clear appreciation and understanding of the importance of social development and social issues, where we need to be able to say, how do we deal with issues, and particularly social challenges that might impact on even the messaging that we are trying to do to make people to be, to change their way of doing things, change their attitude. So the advent of the virus, in fact, has been accompanied by a multiplicity of hardships that are being experienced by each one of us at personal, community, national, provincial, and local level. And I'm informed that social scientists have started to characterize how this pandemic is configuring our society. And the issue is that, are we, both at government, at private sector, at civil society and others, are we really looking at this configuration, and what are we doing about this configuration? Are we going to wait until the end of this configuration, or are we going to use the very platform in which we are in today to say, what is the start? But young people who are students of sociology and a whole lot of things, it's important for us to say to them, can they look at this reconfiguration of our society? And the reconfiguration of our society also means we must be able to look for better ways of servicing our people. And when I speak about servicing our people, of course, I can talk about the fact that Department of Social Development is a department that is concerned with the well-being of our people, and therefore our response should be a response that is sensitive to their needs, that is sensitive to the places where they are, that is sensitive to the challenges, poverty, unemployment, and inequality. And therefore, people would ask, as I see here, about the social grants and what has been happening around SASSA, and in particular, a few places where we saw not so very good things happening. And like in Belleville, I mean, I think everyone is asking about Belleville. And let me just put things very straight about the issue of Belleville. There's absolutely no way that myself as a Minister of Social Development can agree to some of the treatment that was there on the people of Belleville. And by the way, it wasn't just the people of Belleville, it was people that were coming from the surrounding areas who were not able to access the services because many of the service centers had been closed in the Western Cape. And we are dealing at the moment with an issue of how can we get those service centers to be opened. And secondly, I also want to say that the issue of the police who sprayed water on the people, there is an investigation that is ongoing. But I see that out in the public, there's also misinformation that says I am the one that asked the police to do that. I want to put it categorically clear here that I could have never asked the police to do that. It's not my responsibility to direct the police what to do in terms of the work that they have to do. But also it wouldn't have been something that I can say the police must do, to go out and spray water, particularly on people with disability. Some of them were on wheelchairs. Some of them were sitting on the chairs, of course, but many of them were standing, and they've been standing for a while. So I want to put that very clear to this meeting. And I'm raising this because I'm looking at I was looking as we were talking, some of the questions that are being posed here relate to those incidences. This is a caring government. This is a government that wants to do things better for its people. And we made a presentation to the portfolio committee today, and we made promises to the portfolio committee that will come back with a better plan, because I still think that we are not necessarily responding as adequately and as quickly as we want, as it is supposed to be, to the needs of our people. And my responsibility is to make sure that some of the things that are happening here, there in SASSA offices, and people sleeping out, I'm committed to changing that, so that the services must be brought closer to the people, so that people don't have to be traveling long distances, so that they don't have to be sleeping in post offices, so that the rain doesn't fall on them while they are there. It's my commitment, as well as the department, to make sure that such things are things of the past, and that's what we are committing to, which also includes the fact that our working together with the NPOs at a local level, our ensuring that provincial government and local government also responds to assist us, because it's not only just the Department of Social Development that has to respond to this. It's infrastructure issues, it's transport issues, it's all those issues, and we are committed to taking those issues forward. So this platform that we have here today, for instance, the places of resilience, these are places of resilience within our communities. and it is recrystallizing where our formal institutions and scientific systems are falling short of explaining how our people should handle the unprecedented challenge that they encounter on a daily basis. For instance, the rituals, deaths, and mourning, and the psychosocial support that we are supposed to ensure that we cover as a Department of Social Development. And therefore, we cannot do that without working together with yourselves. The diversity of communities from across South Africa have in their own evolving traditional and faith toolboxes, the appropriate tools within which social behavioral bridges can be built between, on the one hand, incomprehensible events and institutional and scientific blind spots, and on the other hand, and our people. And we are saying this is the platform which we need to use. We also believe that it is from deep-seated appreciation of the inherent role of faith, traditional faith systems, communities, and demographic focused communities, for instance, people with disabilities, lesbian, gay, bisexual, trans, and intersex, that is in quote, LGBTIA+, that Minister Mkhize and I initiated the Ministerial Advisory Committee on Social Behavioral Change. And in the communities wherein these social phenomena are put to work, the various champions of these causes perform the delicate and often ridiculous role of driving motives that are out of favor within the strengthen bonds within the and between families, communities, and society as a whole, while at the same time preemptively lubricating the multiple interactions between the different moving parts within communities and society at large. And therefore, government's pursuit of public-people's partnership, you know, we always talk about the public-private sector partnership. As a department, we think we should talk about the pursuit of public-people partnership with communities, and we believe that it is central to our continued development and contribution towards South Africa's effective collective prosperity in the face of COVID-19 pandemic. And therefore, through public-people partnership, that is the Ministerial Advisory Committee on Social Behavioral Change, the conditions that are conducive to the organic emergence of the South African we want will materialize. This public-people partnership will result in healthy, productive, and self-sufficient South Africans who meaningfully belong to communities of their choice and positively contribute to our national essence and wealth. And therefore, this Ministerial Advisory Committee on Social Behavior is a cross-societal recognition that contours of each of our faiths, traditions, and communities run deep through our lives and the configuration of our common heritage. I think that, Chairperson, as I indicated earlier on, my plea would simply to say, can we make sure that even though we are here globally here, as from a global perspective of South Africa, we might be able to look at different sectoral work that we might want to do so that the work continues to happen. We don't have to wait for this meeting. And I know that from an administrative point of view, the Department of Health and my department, the officials, are doing a lot of technical work on the side. But I just feel that we must be aware of the technical work at all times so that the guidance of what needs to be taken, for instance, to the NCCC or net joints, Minister Mkhize and myself are the only ones who sit in there. And therefore, I think we should be able to be consistent in having these meetings. Lastly, I also do think that outside of the MEC itself as it is, within government itself, there are other departments that we might want to pull in, maybe not necessarily to belong here, but when there is work that needs to be done here, I'm thinking, for instance, about education, about the Department of Sports, Arts and Culture, because behavioral change can be changed through a variety of things. I mean, we watch TV, we listen to the news, we watch the radio, and there's the media and communication. They also need to try and help us in terms of entrenching the thinking of changing in the behavior for South Africans, not only based on COVID-19 and the impact that we have had, but generally a broader societal change that we need as South Africans. Thank you very much. Or before I go, please, I just wanted to say most of the comments that are here, it would be very good for us to get those comments, because we might be able to respond differently to them, because it's impossible to respond to all of them as they are here. And the time is not allowing us to go through all of them. Thank you very much.
No, thank you so much, Minister Zulu. And again, thanks, Minister Mkhize and Director General. Colleagues, we have heard, but I would like now, before I open up, because I think it's quite key, a lot has been said, presented by both ministers and DG, and we want to really afford, part of this conversation is engagement, because it was not just to listen to the presentations from government, but also to engage so that we can get, at the end of this engagement, is to get ideas, opinions, but also advisories that government must take into consideration, that will help us move things forward. But I want to request very briefly, so that I start also immediately after that, recognizing the hands that are already up, because there are many questions as well that are directed, which will go into the chat box as well. But before we go into the chat box itself, Bishop Mpumlwane, maybe just to highlight, the work done by South African Church Council's Council of Churches. I apologize, Bishop, and as well as Tulani Chefuta. Very, very, very briefly. Bishop? Can Bishop be unmuted, please?
Bishop can unmute.
Thank you very much. No, actually, the idea here was to say, as I said at the beginning, we would like to encourage organizations to think about, because all of us are doing something positive. Everyone is doing something they can do in their corner. Ultimately, the idea is to see how we can all contribute and bring our efforts together. And what we had planned to do was to just give 2 minutes, examples, from different organizations as a way of saying, here's what we can all do together. So I'm going to ask Mkhize Sibanda to do that in 2 minutes.
Thank you very much, Bishop Mpumlwane, and good evening. Good evening to the Minister of Social Development, Ms. Lindiwe Zulu, the Minister of Health, Dr. Zweli Mkhize, Deputy Minister of Health, Dr. Joe Pahla, leaders and representatives of civil society organizations, members of the multi-sectoral Ministerial Advisory Committee for Social Behavior Change here, and officials of the Departments of Health and Social Development. If I can be allowed to just share the screen, oh, thank you very much, I see it. I will just very briefly go into a presentation around our contribution as the Council of Churches in terms of what civil society has been able to achieve during these COVID times and what we are able to offer as well and continue offering as we go into what is going to be a tough time with the vaccine rollout as we have seen. So briefly, just to put into context, as the South African Council of Churches, in March of last year, the national church leaders developed what we call SACC COVID Pastoral Response Plan. And this is what Church in Action was born out of as a mass communication platform that provides up-to-date and accurate information on the virus in order to help our congregations, but also our communities at large to be safe and to care for one another in the time of Corona. And we cover various topics on our portals and on this platform, including how to care for caregivers, caring for the sick, conducting funerals, which was quite a pressing matter from last year and it still is today, and how the churches are able to support communities during this time. We do provide our content in multimedia content, so videos, posters, and across various platforms, and we do so in all the 11 official languages, which makes it much more accessible to the public. So this is just a snippet of the types of information that we cover, and I've already touched on those. And we also provide useful links, including some of the resources that are provided by other civil society partners and organizations, as well as the various departments. I would just like to also highlight here, and we've got with us our partner, Dr. Garth Jaffet from Heartlines. As I said, the Church in Action Initiative is a collaboration between SACC with Heartlines. And what we quickly did, recognizing the misinformation that is going around in terms of the vaccine, and recognizing that we too can play a role in supporting good and reliable information around the vaccine in order to counteract the misinformation that has been spread. So we have developed a guide here, our COVID vaccine guide, which we developed this month in order to provide facts around the vaccine in order to empower communities. And as part of this, we're also engaging with our national church leaders, but also hosting some webinars online on social media in order to unpack this document even further. I will just briefly just show you the document. So it is here on our website. You're able to download it. At the moment, we have put it in English because we quickly wanted to put it out, but we're in the process of also translating that. I will just ask Dr. Garth Jaffet, who was the person who really quickly helped us to put this together, to just touch on what is in our vaccine guide and what can be used for, and how together we can use it as our contribution to communicating the right information to our community.
Can you do it within 60 seconds?
Yes, he can.
Okay, quick.
Garth?
Okay. If he's not coming in, I want us
sorry,
to...
I wasn't. I was unmuted. No,
Okay.
Please go ahead, Mkhize. I think the key thing here is that it's been written to try and make a lot of the vaccine issues accessible, and a lot of the questions that have been asked around the efficacy, the safety, how it's given, what are the side effects, who developed it, who gets it first, what are some of the myths. And I think rather than go through it now, I think we can make the link available, and hopefully by next week it will be available in 11 languages. It is available to be adapted and used by any organization. Thanks, Mkhize, and thank you, Chair.
Thank you so much. Thank you. Next, Nhlanhla. And I've got hands immediately after Nhlanhla so that we can have this thorough engagement.
Good evening. I will just request that Olive shares our presentation. I will go through it quite quickly. And could I just request, because I'm also using the computer whilst I'm connected to the phone, I will request to switch off the video. Whilst Oliver is actually trying to share our presentation, just quickly, as we formed the Community Constituency Front last year in April, it was formed by the organizations of the SANAC, Civil Society Forum, as well as the NETLEC community constituency. And we began like a process of responding in mostly 4 areas plus 1. The areas we were focusing on was social mobilization, it was advocacy, it was communication and behavioral change, as well as issues of human rights. The 5th area was about supporting the Department of Health in contact tracing and the screening, and then like referring for further interventions. I think that's the wrong one, Oliver. We are dealing with the other presentation, but I will continue whilst the presentation is coming on board. Now, the community constituency recently has basically been advocating quite significantly for the social behavioral change, both advocating but also undertaking programs to address behavioral change using various mechanisms of engagement. Now, this is to encourage personal accountability in driving change in behavior. We also intended to identify gaps as opportunities to drive change of behavior and to discuss key issues affecting people not to comply with COVID-19 regulations and positive behavior across different sectors of society, in particular the youth. We also use the voice of leaders as influencers in behavioral change. Now, in terms of the programs that we have undertaken, we have got a 3-step approach. The first is strategic use of the media. The second is reinforcing through leadership as messengers, and the third is on the ground engagement through neighborhood agents. If you could move, Oliver. Yeah, in terms of step 1, we have got a program which we call Think Twice About COVID. The program covers advocacy, social mobilization, and community engagement, as well as communication and public awareness. If you could move as well, Oliver. So we have done activities in the month of December. We had noted actually because we've been at the parts of the response between April and November. We noted that as a country, during the period of national alert level 1, we all became very complacent across the board. But in particular, as the community constituency, we kept on actually sounding the alarm about the fact that almost all the interventions that are being done are not actually directed at unmitigated communication with our communities. So when we actually entered the second phase, we stepped up our efforts to ensure that we speak more with people and actually like foster the culture of wearing the mask, wearing it properly, social distancing, as well as other hygiene protocols. Now move to the next slide, Oliver. Now, step 2. What we're also doing is reinforcing true leadership. True leadership as messengers of the social behavior change. Next slide. The leaders as champions. What we do, the leaders of the community constituency fund, made up of leaders of SANAC, CSF, and NEDLEC community constituents, are champions and advocates for community-based measures through their voice in various platforms. The leaders are operating at various levels: 1 national, provincial, local, ward, as well as just through NPOs. Leaders play a pivotal role in ensuring that the work of the neighborhood agents is linked to government work. And if we can move.
Yeah, can you wrap up, Nhlanhla?
The third step is on the ground engagement. Just to basically summarize, we have employed or have volunteers as neighborhood agents that are actually going door to door, but they are also speaking to people in their spaza shops, in petrol stations, and various other public facilities. The neighborhood agents are sending out the messages that we need to get out there. Just maybe like to conclude, so that I don't go through all the presentation. Just to conclude, we had conversations with government as early as May through the Department of Health as well as the Department of Social Development. But we think that there's been a missed opportunity of really collaborating and actually engaging with the people on the ground. The vaccine issue, as we are dealing with it now, we are finding that it's not just also only about misconceptions, but there's also like fundamental objections that our people are raising. And when we are talking about behavioral change, it's also important for us to engage with people in their own milieus so that we are able to also get back their feedback. We therefore believe that there's an opportunity moving forward of running a massive campaign across civil society together with government as well as other social partners to drive this social and behavioral change in action. And whilst we have also sustained the success of the above the line like PR campaigns and so on and so forth, we also have to deal then with this unmitigated communication between these neighborhood agents and the public. So in conclusion, there has to be all type of support, including in particular financial support for social and behavioral change. I thank you, Chair.
Thank you so much. Colleagues, there are quite a number of questions that are directed to Minister Mkhize and Minister Zulu. And I want to first take the hands that are up, that I request colleagues, and I will call those names so that we can have the host unmute colleagues to speak. And then we have the questions that are put in the chat box. Of course, that is in relation to the vaccine campaign and also how we look at the public health system. And I'm hoping both ministers are noting these questions. I know Minister Zulu had touched on some of the questions already in her input. Let me start with the hands of Mandisa Mbele. Next, it will be Hedley Lewis. Let me start first with those two hands and then I'll take the other hands. Mandisa.
Okay, thank you very much, Chairperson. I hope you can hear me.
Yes.
Yeah, actually, my name is, let me just first greet and acknowledge the presence of the ministers, both Minister Zulu and Minister Zweli Mkhize. And also, let me just say all the protocol observed. And then what I'm actually, my name is Mandisa Mbele. I'm from Dr. Kenneth Kaunda District Secondary Cooperative. Maybe somebody will just say, why do we have cooperatives? But at the end of the day, it also affects the cooperative, also even the operation of their businesses as well. But what I was going to suggest and propose in terms of the partnership to make sure that there's a proper awareness and that can really go to the ordinary people that are in the townships and also the ordinary people in the rural areas. Because what we did when we were doing the issue, encouraging people during this COVID to use their backyard garden to have some vegetables planted there. Now we have found out that there's a lot of confusion in terms of your social media, where they say others were saying, no, but we are told that you mustn't go for this vaccine. This vaccine is going to kill us. This vaccine is connected with 5Gs and all that stuff. So you'll find that maybe the community don't understand, and they are so scared, to be honestly. And also in terms of the people that have been affected, that have contaminated this thing, the COVID-19, for them, for their recovery, it's really affecting them bad, because psychologically, you'll find that when you have been affected by this COVID-19, then it will take you 3 to 6 months to can really recover into it. Then in between, you'll be having some certain instances where you will be having your what to call your panic attacks and so forth. And especially now, there is level 2 where people will hear there are people that have died and so on. So all those informations that are in the social media, that I can't say most of them, but they are really confusing our community. If then we can partner, really go to the community and make sure that we make this thing as simple as possible, and encourage them that a vaccine is there. And there is a question that we're also asking, that why is this vaccine done on the other country, why it's not done here? So all the information that we are getting from here now, it's really going to assist our community to understand that it is important that they go and do this vaccine.
All right. Thank you.
And also I'm sorry.
Can Hedley Lewis ask his question? Can I request that we can ask directly those questions so that we don't take too much time? Hedley Lewis? Okay, if Hedley is not ready, can I take Ntate Moepi? Neo?
Hello, hi, I'm Hedley Lewis. Sorry, sir. Apologies, I just I hadn't been given the approval to be unmuted. Honourable ministers, members of government, and my fellow colleagues in civil society. I think first of all, I think that we obviously want to pay tribute to our government for the fight that they've already put on. And I think that civil society that all sits here wants to augment even further the support that our government is already doing. I think that the question is, how can we get more communication directly from government officers, as well as how can some of us that have already played roles in various meetings, structural decisions, as well as strategies, get more involved. I mean, I can see various of my colleagues that have already been involved in the Presidential Health Compact, and representing both the SMILE Foundation as well as the patient user group. Obviously, the main thing is to be able to get information to the ground, to patients, and to those people that may not have the general mediums that most people are speaking to and from. My other thing is, obviously, communication is a key thing. A lot of us are getting information directly from various entities in Department of Health, but I'm not sure how we join the Department of Social Development and support them in the communication, as well as receiving the information, as well as structurally maybe helping with compacts in that environment. And the second area is to get maybe some of the creatives and the information that is wanting to be put out in the various language that we can augment and support, and similarly to grow the voice of government. I think at the moment, government is speaking, we're hearing the government, but obviously the NGOs as a complement and civil society as a whole over here have the opportunity to add and to really grow that voice. And I think that with the vaccine, the myths, the stigmas, the nervousness, obviously our NGOs have been seen as a trusted conduits between often government and the people, and we're looking forward to how there are the possibilities in those two areas.
Okay, thank you so much, Hedley. I'll go with Neo Moepi, Human Rights Witness, South Africa, I think, and then Jenny Black, and then I'll come with the other names as we continue. Neo, go ahead.
Excuse me, Speaker, is Neo before me? Is Neo before Human Rights Witness South Africa?
Go ahead, Human Rights.
Okay, perfect. Thank you so much. The main question here is what we've noticed is that government is very selective on the science that they choose to approve and put out to the people. And the big thing that is happening in our view is the media is spreading so much fear. And you know that fear can physically kill you and weaken your immune system. So the big question is why is the media spreading so much fear? And also the other question is, why is SAPRA being static instead of being proactive? I mean, if in unprecedented times like this, then we all need to get out on the ground and put our heads down and work together. So why are these people, namely SAPRA, why have they gone out of their way to immediately dismiss ivermectin as a possible treatment? Instead of going out investigating this more in a deeper sense and just being more positive. I mean, people are dying from fear more than anything, in our personal opinion. And there's one instance where Yuvan Gounden, the spokesperson for SAPRA, was caught in a blatant lie on national television. And he directly contradicted the CEO of SAPRA, where Yuvan Gounden actually said, in his own words, that ivermectin was untested and unsafe. Now, this is a person that is a spokesperson for one of probably the most important organizations in South Africa at the moment. And he says something like this: this medication has been around since 1987 for human use. It's treated approximately 3.7 billion people successfully. It is a handful of people that have complained of severe side effects. So where is SAPRA coming from, and where is SAPRA's Nobel Prize? Why did they decide to just ban this medicine before investigating this further themselves?
Thank you so much. Nell is next. After Nell, it will be Jenny, very briefly.
No, thanks, Professor. I was becoming worried because I was recognized twice and people came before me, but it's fine. I'm not well myself. I just forced to be in this meeting. Firstly, let me appreciate the invite and the presence of the two ministers, Minister Dr. Mkhize and Minister Zweli. I have privately made a request to Minister for Health to try to avoid populating this meeting into a Northwest issue. I'm hoping to get a response on that. But let me quickly bring 2-3 things in short. One, I think the subject is very important. However, my feeling is that we are talking at the time when we should have spoken as early as last year, April, if not March, on what we should be doing or what we are doing or what we are planning to do from civil society point of view. Because now we are talking about a vaccine, and I believe the discussions have gone too far to a point where whatever we say will not be able to change the position and the decision of government. Now, let me lastly indicate the following. As a sector of people with HIV in the province, we have been trying our best to engage communities through different platforms of media, especially community radio, to raise awareness and also to make sure that we educate our people and we also simplify what the president and ministers will be saying during family meetings, because in the main, English and Zulu and partly Xhosa is used than languages that are popular in the Northwest. So we have been trying to do to close that gap. But my biggest challenge from experience is that with closing of places of worship, which are themselves part and parcel of civil society, I think government has erred, in my view. And maybe they have not just erred because it was deliberate. It was not. It is one way or the other, failure of religious leaders that are engaging with the president and ministers to indicate workable and reasonable programs that can be done, except preaching and teaching and collecting of collections on Sundays or whatever the day when churches are in. I am of the view that we must reconsider reopening of places of worship and use them as places where our people can be motivated, can be given some sort of counseling, like the latter speaker spoke about fear. I'm an example of that. I nearly died because I was under stress and depression, at the same time COVID positive. If I did not fight the way I fought in prayer and refusing to be admitted, I'm sure I would be dead. And one of the things that I realized is that we need places of worship, but not for church. These are centers that can be used to motivate, rehabilitate, and also be places of health service for our people.
Thank you. Thank you. I'll move quickly to Jenny Black and President Cindy Mzamo. Rehad Desai are the three next speakers. Very briefly and maybe straight to the point. Thank you.
Thank you very much. Can you hear me?
Yes, we can. Thank you.
Okay, thank you. All protocols observed. Thank you to Minister Mkhize and Minister Zulu for attending. Minister Mkhize was really and human resources in the health facilities. Can you hear me?
Now we can hear you. We had lost you for a second, Jenny.
Sorry. Okay. All right. I'll start again. Minister Mkhize was recently in KZN for oversight visits. He brushed over the KZN department's lack of a plan for increasing human resources in health facilities. What is the department's plan for increasing healthcare worker numbers? What is their plan for filling the gaps left by many of the healthcare workers going into self-isolation? Also, why are the healthcare workers who took up the call to assist the department still waiting placement in hospitals 3 weeks after they applied? I'm part of the Pinetown Clinic Committee on Ward 18. We have something like 11 nurses servicing over 18,000 patients on a monthly basis. We are understaffed there by at least 11 nurses on that number. So that's my question for Minister Mkhize. My question for Minister Zulu, if you just hold on for me. Minister Zulu, what are you doing about the you sit in a police armored vehicle and shout at disabled recipients through a megaphone and then watch as they get hosed down? I'm aware that you told Parliament that you thought it was wrong and put a stop to it. But yesterday, in fact, your first response to the media and people who criticized you was that people need to suck it up. That's not acceptable. Also, how in 2021 technology is it that people still need to queue for their grants especially during a pandemic? Surely they should be able to have money loaded onto their cards, cell phones, or bank accounts. It should not be necessary in a pandemic to be putting people's lives at risk. You have failed miserably, and you are creating a bigger pandemic.
Thank you, Jenny. President Cindy, quickly.
Thank you very much, Chair. And I'd like to thank Minister Zweli Mkhize and Minister Lindiwe Zulu for such a powerful platform of actually getting us together as civil society. And as the president for the sector of global business women, this is very powerful because it talks about collaboration. It talks about government departments working together to actually make sure that we face the challenge together. Why I'm raising this issue, the South African Medical Association is a member for the sector of global business women. Already we are working with the Minister of Water and Sanitation, looking at airborne diseases in rural communities themselves. And we've partnered with an organization that is called Africa Grain and Seeds, and we're going into rural areas to look at agricultural initiatives so that we can empower rural communities working in partnership with our government. And also what I'd like to suggest is that we need a very strong social media campaign so that we don't have a lot of negative issues that talks about the vaccine, and yet we know that the vaccine is going to help our society. So I think moving forward, Chair, let us come up with a very strong social media campaign so that we'll be able to actually, mitigate the fear amongst our people in South Africa, because the vaccine is going to help us. But we need to actually come up with a very strong social media campaign. Thank you very much.
Thank you so much, President Cindy. Rehat Desai.
I can't show my video. I think, there are a couple of things that I think the key thing here is, I think certainly I was a bit disappointed by Human Rights Watch. I think Invectamin is a bit of a distraction. We've got a major surge happening. We've seen thousands of deaths this year, and we're in trouble. And of course, we know that after water, access to water, vaccinations have been the single most important health intervention globally that we have. We have to recognize that. And we have to recognize that we still haven't got a clear commitment from government as to when these vaccines will arrive, and therefore planning is very difficult in that. Also, we've got problems with the math, saying that we can do this within the course of this year, when we haven't actually know how much we've acquired, and the fact that it's going to take a lot of time to do it. So really, the proposal from the C19 People's Coalition, which represents over 400 organizations, and the People's Vaccine Campaign, which it initiated, which has now over 150 organizations and some leading individuals, including archbishops and so on, is that we have a meeting of national organizations, a round table to get to the nitty-gritties of how we're going to, one, counter the misinformation. What are we going to do about this lobby of disinformation? People stand to benefit from all this anti-vaxxer sentiment. What are we going to do to ensure that we get our people, we've got 50% of our people saying that they don't want to take this vaccine. So the education efforts are critical and have to go up front. We need to get organized in a very solid way. We're a bit disappointed with SANAC that you haven't invited us for a meeting, even though we've been very vocal and so on. The community constituency front. There are many civil organizations out there that have got very large constituencies with high degrees of legitimacy, and we've got to mobilize them in our efforts. And finally, the rollout plan has to involve these same community organizations, these same community leaders, to give it appropriateness and to ensure it's effective. We've seen what's happening elsewhere in the world, with states that have got bigger capacity than ours, stronger capacity than ours in getting this vaccine out once it arrives. So that would be my plea. We need to sit down and work out some modalities of engagement.
Thanks, Rehat. Let me move to Bridon Mokwena, Mamora Kulolo, and Pastor Klope. I'm following the order of this list as it comes out. Bridon Mokwena, quickly.
Okay, thank you. Can you hear me, Chair?
Yes, we can. Thank you. Go ahead.
Okay, fine. Thank you very much. I just want to quickly go to what my doctor has been presenting here. And firstly, before I go to that, I just want to say compliment to the speech of Minister Lindiwe Zulu, where she said like it's a very good setup for meetings such as this one to be planned and to be put in order. So I appreciate that as well. I think it will help at some point. But to come to my point, it's like based on what the doctor has presented, I didn't hear any rollout plan that involved any civil society organization other than the one where he mentioned that community workers will be vaccinated. So exactly what I want to ask from the Minister Zweli Mkhize is that what is the plan exactly about the civil society organizations? How are they going to communicate the issue of vaccine with the people on the ground? Because as far as I know, us as the people who are running the civil society organization are the one who's having the clear and the very good bond with the people on the ground. But the communication from above is more like there's a communication breakdown. So I just want to hear exactly what is the plan from the minister. How is he involving us as the civil society organization people so that we'll send straight the information to the people who are on the ground? That's what I want to.
Thank you. Mamura Khololo. Okay, if she's not coming in, Pastor Trope, and then JD next.
Thank you very much, Chair. I greet you all and greet all the ministers present, Minister Mkhize and Minister Zulu, and all my colleagues as well that are present here. Maybe
Please unmute me.
Sorry? Okay, maybe with my three
Hello?
questions that I have.
I think it's
at first.
Hello?
Okay, we will take you after Pastor Trope now, Mekhololo.
Yes, what I'm saying here, Chairperson, is that there's been a number of things that people are using and they've been coming and saying these things are working for them. Like some people are using lemon, garlic, ginger, and all of that. So with the same medicine that has been that was used by one of the doctors in Verelem, where you find that now the doctor is facing this and then now SAPRA wants to test and all of that. Why are other stuff that people are using are still not actually suspended to be sold on retailers? Why people are still able to buy such? But specifically on this medication, now there are some investigations going on, and then suddenly it's no longer available for resale and all of that. Then the second one, with regards to churches, maybe at times we need to look things in a broader extent. For example, we can use churches not for worship, but as some kind of educational centers where people can come, get to be educated about COVID-19. Because right now in 2021, you still have people that still believe that COVID-19 does not exist. And if you have got people who are actually thinking about that at this time, then it means that our government is lacking somewhere. Something is not being done by our government. So we can actually use those places of worship. We teach people about vaccine, the conspiracies that are actually going around. We need government as well to tackle each and every of those kind of theories so that people get to be educated. Because when you say you're not going to entertain such conspiracies, people are actually taking those things seriously, and it makes them feel a bit suspicious. And then maybe on the last one, let's remember on the Department of Social Development, the 350 Rand lines that are always on at post office and the lines, long lines. At times, those people are not even wearing masks because no one is there to monitor them. So you find those lines at post office, the same lines you find at the UIF offices. But we have never had these two places being called super spreaders. Yet you'll find people saying churches are super spreaders. And then they won't say about malls and all of that. So I think we need to be realistic about this because we want to work as a collective and stop selecting certain places and saying these are super spreaders, whereas places that we pass on daily basis, like post office and SASA and other places, which are actually always full, crowded, non-compliant. And then we keep quiet about that. Thank you very much.
Thank you. Okay, Mahololo, and I just want to identify the last few hands that I'll be taking, and that will help us just to get responses and next steps. Mahololo, are you back? Okay. If Mahololo is not back, JD, go ahead quickly.
Thank you very much. Can you hear me?
Yes, go ahead.
Oh, thank you very much. As you said, I'm Lindan Songo, JD. Please, comrade, may you allow me to greet the ministers available, Dr. Zweli Mkhize, Ms. Lindiwe Zulu, and all distinguished guests present. Our role, I'm a leader of the JEG. Our primary objective is to fight for graduates whose qualifications are withheld by the institution due to outstanding fees. Therefore, we say we cannot ask today, but we need to put something on the table for our government to work on. The justice and equality for all graduates believe that this pandemic has aggravated the situation of inequality within the country. The inequality was there, but with this silent killer, it is made seen by everyone. We therefore wish to see young people, especially the unemployed graduates, given the role, create COVID-19 awareness as it linked with 5G. We need energetic and vibrant people to distinguish to the society the difference between the pandemic and the 5G, because it seems as if our society is discombobulated when they hear the vaccine at the same time, while they believe that they died because of G5. We need people who will distinguish or make the difference between the two. Those are the unemployed graduates. That's our belief. We need to see the unemployed graduate to play a role and mandated is to distribute the vaccine and monitor the whole program, in which.
Okay, no, all right, thanks, JD. Can I go with these next speakers quickly? These are the few remaining hands. Kelly Duplessis, Keke, Casey, Kemano, Fikile Vilagazi, and Dan Kekano.
Thank you very much, Kelly Duplessis, CEO of Rare Diseases South Africa. I have two questions, the first being for Minister Mkhize, and I thank you very much for the time for the elaborate overview. I just want an understanding on how it would be possible to submit applications for the vaccination for households where there are vulnerable members in the household, such as vulnerable children and teenagers with life-limiting diseases, or etc., who are not able to either follow social distancing because of either intellectual disability or due to their conditions, or and are also going to be excluded from the vaccination program, obviously due to their age and the fact that the safety studies have been for adults over the age of 18. Is it possible to apply for adults within those households to be able to get the vaccine, even though they specifically may not have comorbidities, to alleviate the risk of bringing the COVID home, obviously to the vulnerable child or the vulnerable teenager, is my question for the Department of Health. And then with regards to Minister Zulu, I would just like to say that as a non-profit organization, we have surely looked for the door that you speak of. And we have sent emails, we've sent tweets, we have engaged on social media, via telephone, every opportunity that we've had. And during this time, I think I can speak on behalf of many NPOs to say that we have felt completely abandoned and unsupported. And more needs to be done from the Department of Social Development to keep up the morale the group that is categorically standing there on the front lines, serving our country and making sure that the very vulnerable members of society get access to what is needed during this pandemic. We need government support, and we need to make sure that the lines of communication remain open, and that when we also bringing challenges to the table, that they are heard similarly to how we all respond to these sorts of calls for engagement.
Thank you, Kelly. Keke?
Hello.
Yes, go ahead. We can hear you.
Oh, thank you so much. Thank you so much for the opportunity, and I'd like to recognize both ministers and the civil society representatives that are here tonight that made the time to be with us. I just wanted to ask a few questions, and starting with the fact that it is common view that vaccines are really about money and not really preserving lives. And I'm saying this because why is it that we are being held hostage by pharma and their patents? Why is it that when the world over is sitting here going, people are dying, we need medicine, and we must deal with patents and the protection of capital by pharmaceutical companies? Why is it that as a country or as countries, we have literally almost agreed for pharmaceuticals to decide who lives and who dies? And why is it that the South African government is actually playing to this tune? Secondly, this question goes directly to Dr. Zweli Mkhize. Dr. Zweli Mkhize, I know for a fact that over 30 million South Africans prefer to use traditional or herbal medicine. And I know for a fact that I personally reached out to you to ask if we could engage on finding a solution that is a locally based solution using biotech as well as indigenous knowledge to find a solution to COVID-19. And you totally ignored us. You totally ignored me in particular. And here you are coming here and asking us to endorse a decision that you made by yourself and the people that you sit with. How are we supposed to accept this when you have failed to find a locally developed solution? I thank you.
Thank you, Keke. Casey? Okay, if Casey is not coming in. Oh, Casey, yes, you are unmuted now.
I'm here. Thank
Yes.
you very much. And thank you again for the opportunity to speak. I know it's really late, but I think it's an important discussion. Thank you to the honourable ministers this evening. I think what's also really important just to highlight is that we as the NPO sector, and we're all across the country at the moment now after 10:30 at night, we're wanting to engage, we're wanting to help, we want to be part of the solution. My question is probably to both the ministers this evening, is that there's national recovery plans for business, even the mining sector, and yet only after 300 days, we're now celebrating or commemorating our 300 days of since COVID lockdown, do we get to engage and have this conversation and be brought around the same table? There's forums and committees for health, business, faith-based, and yet where is the forum for NPOs? Where is this national strategy to look after NPOs during COVID who are on the front line helping communities? There's various NPOs with valuable programs that we want to share, we want to collaborate, and we want to bring our expertise. Where are more opportunities? This session has been really great to be around the same table, but this is not an engagement. It's after 10:30. We want to do more. So I think my question is, what happens after this? Where do we go from here, and how do we continue to work forward? Another issue, and my name, sorry, is Cassie from the South African Depression and Anxiety Group representing mental health, is we know the COVID impact on mental health. What I am really concerned about is that a lot of our mental health residential facilities and NGOs did not receive their grants in December, and they were battling to feed their patients. How are we supposed to even touch sides with regards to COVID when we've got very vulnerable, very ill patients who are not getting fed? What is the strategy there? Thank you very much.
Thank you, Casey. Give me now. Peter? Yes.
Thank you very much. Let me first start by sending my greetings to the
Can you speak closer to your mic?
Okay.
Yeah.
Let me first start by greeting the ministers right there, Minister Mkhize and Minister Zulu, the SANEC, and my esteemed colleagues. First of all, my worry is I'm from Tswelelampele Dingaka Association. We are a traditional healers organization, and my problem is that within these 300 days of COVID, traditional medicine has been set aside. We have not been given the opportunity to come and give an alternative to vaccines on how we can mitigate these COVID-19 problems that we're currently facing. What is it that is being done by the government to ensure that we also are listened to and we are also given and afforded the opportunity as African medicine to come up with solutions that most of people have said loudly that they've used traditional medicine to overcome this problem. What is it that the government, why is it that the government is shying away from endorsing African medicine, the medicine that has been there for years, medicine that is 100% organic, medicine that has been helping and currently showing results that it is actually effective when it comes to treating this problem. When will we be afforded the opportunity to advance our very own medicine and bring solution to this problem that we're currently facing? The other question to Minister Zulu, Minister, we are currently facing a pandemic, but the social grants have been a problem. People have not got their social grants. We are told that we need a strong immune system in order for us to fight this problem that we're currently facing. Or should I say, when will you speed up the payment of social grants to ensure that people are able to get all that they need and people do not go hungry while they are sick too? Thank you very much.
Thank you. The next speaker is Figile Vilagazi. Thokoza go.
Thokozani, siyabingelela ngenjabulo. Thank you so much, Chair. Good evening to the Honorable Ministers of Social Development and Health and all protocol observed. Just quickly, I would like to echo the sentiments around traditional medicines and traditional healers. And I'm speaking as Isangoma in South Africa, coming from Ikwelo Healers Collective, to say, Minister, why did you ignore us so much? Why is it, Honorable Minister, that you are avoiding us so much for so long? Why did you take so much time to communicate to traditional health practitioners in particular, particularly around solutions that are driven from a community base, from the people? Because the kind of work that we do is very much centered and close to communities, and we offer solutions that are right at the doorstep. So that is the big question. And what is the take of the ministers in the role of indigenous science? Because the kind of work that we have been doing, we really have been engaged on finding solutions towards this kind of pandemic and other fevers, being driven from the place of indigenous science. So we are experts in that. We've got expertise that we would like to offer and share to combat this pandemic that we are all faced. And of course, the other question is linked to why did we go to India and not Madagascar? Just linked to that, what is our take around COVID organics when we have it on the African continent? Given the fact that, of course, we are leaders of the African Union through our Honorable President Ramaphosa. Committee Chair, lastly, I think just a few questions. One of the things that we support is obviously a solid and grounded campaign around going to communities, which is what I think this meeting is calling behavioral change. But what we are calling for is something that twins a change of mindset around the pandemic that is actually the #1 killer in South Africa, sexual and gender-based violence and femicide in our country. I know that we think that COVID-19 is #1, but actually the main killer of our country and our people in the country is gender-based violence and femicide. And I think it will be really great that we can show the same level of agency as we are doing this kind of behavioral change work within communities, that we do a twinning collaboration in that regard. Quickly, basic needs. Can we please have data, Honorable Minister Uzulu, as a basic need? We are under lockdown, it's a fourth industrial revolution. Is it possible to roll out data as a basic need? Data has become food, data has become water. And of course, it links to the call for a basic income grant. And lastly, Committee Chair, is a question of conspiracy theories. What we are actually calling conspiracy theories are models, are varieties of analysis. We have, since last year, March, have offered a biomedical approach, which we truly appreciate in the agency that the ministers have displayed. But we are equally saying we cannot afford to avoid other ideological standpoints in terms of what actually is COVID-19. So what we are analyzing is conspiracy theories. For those of us who also come from the socio-political and other perspectives, we would like to plead to say, can we engage with these? Because these are at the center of the socio-economic political problems that we are sitting with around issues of the involvement of the International Monetary Fund, for instance, the involvement of the World Bank. A lot of communities are crying about the role of other donors like the Melinda and Bill Gates Foundation. What are we saying about that? So is it really conspiracy? Thokozani?
Yeah, no, thank you so much, colleagues. I was counting the hands that we have, and I'm going to ask both Minister Zweli and Minister Lindiwe that I afford, at least 30 seconds each of these hands, because if I take these hands, it will take us at least until 5 to 11, and then we allow ministers to respond in that regard. I don't want to ignore these hands, but I've counted these hands until Lerato Mofokeng, and I'm requesting the next speakers, if at all you can sharpen your points into just 30 seconds in that. Comrade Dan Kekane, you are next. Caroline Abraham, Guni Mendy, and then I've noted the other remaining, which I'll come to them.
Thank you very much, my leader. My honorable ministers, all due respect to you, ministers and the DGs, and to fellow leaders, my respect to you all this evening. I will not waste time with the point of social grants because it has already been touched upon several times, but I also want to urge the minister to give us an answer as to how can they suspend, at this trying time, suspend disabled people's disability grants, yet knowing very well that they won't be able to assist them. Remember, disabled people are the poorest of the poor. So if you're going to suspend their grants and still not be able to service them so that they can be able to renew their grants, that becomes a problem to us. I don't think it is good that we should do that. And then my second point would be, we should also understand that as disabled people, we have what we call assistive devices for us to be able to continue with our day-to-day lives. So if we are not going to be able to go to health institutions for us to service our assistive devices, that also is a problem because people are being turned back and their assistive devices are not attended to. So those are the points that I would like to highlight and stop at that so that I can save time for others. Thank you very much, my leader.
Caroline Rich, quickly, 30 seconds, colleagues. Go ahead, Caroline. Okay, Caroline is not speaking, I see. She's unmuted. Abraham Guni.
Thank you, Chairperson. All protocols are observed. Because ngifuna ukuthi sikhulume way-forward nespeed. Sizinyanga we are left behind. Kakhulu futhi hayi kancane. Ngenxa ukuthi the ministry yaka Baba Zweli Mkhize iyakhetha ukuthi isigcilaze isikhohle for a very long time. But now we are talking about a sector dealing about a population size of 30 million. South Africans are consultant behind. asazi the vaccine ukuthi izoba njani, asazi anything the education behind the vaccine. Sicela ukuthi nathi include us, ake sifundiswe sikhona ukwazi ngoba abantu baqala kithi bebaya kibo. And then okunye the NPOs, ngiku NPO ngirani NPO, we have been staffed. Okukhona Minister Zulu into eyenzeka last year, abantu ama-officials from the department approacha basitshela ukuthi yena i-funding kanje. Masithi sifuna ama-service level agreement banyamalale. Kwakuyini nifuna ukusenza abotsotsi ukuthi nani ngingabotsotsi?
Thank you. Mandy?
Good evening, all protocols observed. My name is Mandy, obviously from the Scientology Volunteer Ministers. We have been working, obviously, and partnered with the Department of Social Development to offer free sanitization, hygiene education, as well as skills development programs for the last 300 days of the lockdown. Obviously, we will continue to do so in solidarity, and we would like to also acknowledge the Department of Social Development for partnering with us so that we could offer assistance to the most vulnerable in this way. We would also like to offer and extend this service to other NPOs and see how we can partner with them as well. As the point was raised, how do we continue as NPOs to grow our reach and grow our assistance during this time? So I would like to offer that. So if people would like to private message me or be in contact, that's totally fine. Thank you very much.
Thank you, Mandy. Lotta, Mayana, Oscar, Harry Hasler are the three next. Quickly, Lotta, Mayana.
I'm trying to unmute. Thank you very much. I agree with what the colleagues have said, but I wish that most of us have been capacitated in terms of dealing with the mental health issues, because there's just a lot of panic attacks that is attacking our people. But what we then being asked by the communities is that the phase 2 creates a problems because it does not really define as to how that is going to be rolled out in terms of essential workers, because that space we know is not properly regulated and protected, and it's filled by foreigners. So is there a policy in place that will make sure that it puts South Africa first? And also, are we going to implement vaccination card and control on the borders? Thank you so much.
Thank you, Lotta. Oscar, quickly.
Can you hear me, comrade?
Yes, go ahead, Comrade Oscar.
Yes, good evening, my colleagues and everyone else. Just a quick question. I think my colleagues have posed the necessary questions. I just want to ask this one critical question to both the ministers. In actual fact, I want to pose the question to them. I would like to know, are both ministers prepared to engage the THP sector, and how soon can they do this? There are many questions to be asked, and a lot has need to be sorted before we can commit into saying we want to partake in the rollout of the vaccination. So the question remains, are both ministers prepared, and how urgently are they prepared to engage with us, specifically as the THP sector? I thank you.
Thank you, Comrade Oscar. Comrade Harry.
Thanks very much, Steve. Thank you so much, Honorable Ministers, Deputy Minister, and DG for this engagement. My name is Professor Harry Hauser. I'm the Civil Society Forum leader in the Western Cape and the CEO of TB HIV Care, but I also sit on the World Health Organization Civil Society Task Force on Tuberculosis. But as the CSF in the Western Cape, we just wish to acknowledge the leadership of government and the partnership with civil society and the private sector in the response to COVID-19, and we commit ourselves to be part of the solution for containment with non-pharmaceutical measures, as well as community education, preparedness, and delivery for the COVID-19 vaccine. But we also note that since the 5th of March, there have been more than 38,000 documented COVID-19 deaths, an average of 119 deaths per day. But At the same time, there were 159 deaths per day from TB, which is a completely preventable and curable disease, and it's been with us for centuries. So the question is, how can we ensure that screening and testing for tuberculosis is integrated into all of the COVID-19 screening and testing, and how can we ensure that TB preventive therapy and other novel health interventions like HIV self-screening and pre-exposure prophylaxis are scaled up, and we could commit ourselves to being part of this solution. Thank you so much for this opportunity.
Thank you so much, Harry. Lerato Rampete Monde Duma, Greta Makwenkwe, Bale, Betty, those are the names coming up, and then we have the last four. Quickly, your 30 seconds each. Lerato, go ahead. Okay, if Lerato is not coming in, Monde Duma, please go ahead.
Thank you, Chair. Can you hear me?
Yes, go ahead.
I think I will just summarize my point.
Yeah.
Just to say that as Eastern Cape Together Community Action Networks, together working with Rhodes University, we have already rolled up our sleeves too, in terms of making sure the messages go to rural communities and underserviced areas. All that I want to emphasize now as a summary is just to say that we would love to partner with the government and the government to emphasize distributing or disseminating some of these messages in African languages. That's very, very important. For instance, the Department of Health has just developed infographics on the misinformation, trying to educate on the misinformation on vaccination, and that was in English. So we're saying that if that could be in the indigenous languages, and we do push it into the deep rural areas via WhatsApp. Thank you, Chair.
Thank you so much, Monde. Greta? Okay, if Greta is not coming in, Bale?
Host is not unmuting.
Okay, sorry, Greta. You can go ahead.
Okay, thank you, Steve. I'm covered by the other speakers, but what I want to drive at, Steve, greetings to the honorable ministers and everybody present. Steve, I was admitted at Nelson Mandela Academic Hospital. My tests came back twice negative, and the doctor refused to accept them, saying that they are not in sync with what his stethoscope is feeling. Now, my thing is, what I'm driving at is that we can't leave education to chance for people to see things that are trending on WhatsApp and Facebook. Education is necessary. I'm seconding the comrades who are saying, let's use our churches as resource centers, though we restrict numbers. I've been on 2 FM radios speaking, and people flooded me with questions because they need the education. They rely on hearsay. As faith-based women's organizations, we don't meet physically, but we do meet virtually. And with such information to allay the fears of people and to take away all the myths about the vaccines, we need this information, invite people with information to address those cells where we meet so that people are not confused. People know exactly what is happening. So let us use our churches as resource centers, and collaboration as done here on this platform will take us far. Thank you.
Thank you. Thank you. Bale, Betty, Sean, Pelisa, Mamora, Lerato are the last hands. Thank you so much.
Thanks, Chair. Protocol observed, then not take time. I would just wanted to find out from the minister that, especially in the north, many people are using this traditional medication, and then they are saying it's assisting than going to the hospital, because in the hospital they only receive the oxygen. But many that are using it, some of them it's not even counted that has been infected and they're healing throughout the process. So I want to find out from the minister, from the professional point of view, or will this have a bad effect in the future? That's the first one. And the second one to the Minister of Social Development. The issue of NPO support, we agree, we don't have a problem with it, but we were thinking that if they could work with a model of cooperatives, that once they are supported, they can stand on their own, than to believe in a handout. We create a nation that depends without self-help and responsibility. Or maybe what are the measures that we are, so they can be adopted and change the program. Once it was been funded, then it can stand on their own. Thank you very much, Chair.
Thank you. Betty?
Can you unmute? Am I unmuted?
You are unmuted. Go ahead,
Thank you
ma'am.
very much. All protocol observed, especially our honourable ministers. My name is Betty Nieuwoud. I represent Stelcare, Stellenbosch and Districts Family Services. We are a child protection organisation. Honourable Minister Zulu, we have offered our support to SASSA because our people do not have any access to social grants. We have offered our facilities free of charge, Monday to Fridays. We just thought that we can work out a very useful program, and it was stopped abruptly yesterday. So today it was a sad day to send our people again back without any access to services. We have offered services to SASSA, asked them to train our volunteers. We have a wonderful volunteer program called Eye on the Child to train our volunteers to assist with online application. We will provide everything. It seems that this is also a problem. Please, Honourable Minister, I did inbox you. Come to our support. We have spent 1.2 million rand on feeding our communities without the support from any government organization, provincial, local. Please, it is a crisis out there. Thank you.
Thank you, Betty. Sean, Pelisa next.
Am I unmuted?
Yes.
Good evening, good ministers. Good evening, everybody that is participating. Mr. Mkhize, Minister Mkhize, there is no doubt that we do have a COVID pandemic on our hands. I am just perturbed personally, but also from an organizational point of view, that the country is pushing and government is pushing vaccines when we have so much other alternatives. One of them, of course, being ivermectin, but there are individuals here speaking for ivermectin tonight, so I'm just mentioning the name ivermectin, and I'd like to shout it out 20 more times. You know what ivermectin can do, and the department is also familiar with ivermectin. I also need to ask, what is the association? What is the hold? Why can SAPRA not come forward and give us direct clarification? What is the hold on the epidemic as it is? Because what we see on the ground is that government is pushing a one-sided political agenda. And, you know, we almost want to ask, what happened to the 500 billion? Where does this 500 billion come from? And what is government's association with this 500 billion that you cannot look at other alternatives, Mr. Minister? That is all I have to say. As far as Minister Zulu go, you've been asked several questions before, Minister. All I need to ask you, Madam, is can you not do anything better than perpetuate the South African society, standing in queues, standing on the street like beggars? The country has become beggars. Minister Zulu, what can you do to alleviate this problem?
Thank you, Sean. Pelisa?
Okay. Hi, good evening. Thank you so much. And the protocol of observe. I just have 3 advisory points to make. I agree with the colleagues around the funding for NPO sector, because we're not going to be able to partner with government unless there are clear resources in the same way it's been done with other sectors. Then the other issue really also is that I think we need to start also pulling out some lessons learned from other pandemics. I mean, it's not the first time that South Africa is dealing with the pandemic. HIV/AIDS has taught us a number of things. And I hear, for example, some of the things that people are raising here, it's, you know, they actually date back during that time. And it feels as though that we might have lost the plot in as far as, you know, lessons learned during that pandemic. I think the third issue, I mean, having survived COVID, but I understand that, you know, COVID is classified as a respiratory disease. But I think the basic issues that I've learned out of that, I think one of those is, and I think what the Department of Health needs to start looking at is around primary healthcare education. For instance, if your individual intake of milk products, right, of sugar and sweets, of starch and alcohol, you are actually, those are some of the well of vulnerabilities. I know the emphasis has been on mask, the emphasis has been on social distancing, but also I think the lesson that I've learned is also there's a lifestyle embedded in the pandemic. And that takes me into the last point, Chair, I want to make. It's also about the food parcels that we are distributing to communities. Is that, for instance, if the foods that we're distributing to the poor is also starch-based, right? And it has dairy products, which in fact makes people susceptible to actually the infection. So it means that in fact, this is actually a double-edged sword. And it's something that we really need to start thinking about it. And the lesson is simple, is that people need to start cutting down on a number of things: sweets, starch, as alcohol, and as well as a dairy product, so they can survive.
Thank you, Mamoro. Okay, Mamora, I thought you were coming back. Tulani Chefuta, and then Lerato is the last person.
Good evening, Chair, and all colleagues on the call, and greetings to all. Can you hear me?
Yes, go ahead, sir.
Sure. Simply, Chair, is that we must appreciate that as different sectors of society, we have different but complementary roles to play in the fight against COVID-19. And if there are things that you are going to try and get them done through government, those will be suffocated from the beginning. There are spaces where you are not going to find government, where you will only find civil society. You may go to the most rural of areas, you will not find a police station, a hospital, a clinic, or any of those. But you will find civil society organizations 24/7 that are responsive to the needs of those communities. And they've actually become trusted messengers of goodwill in those communities. Our fight against COVID-19 must acknowledge and leverage those as channels of communication, education, awareness, and even support in those communities. And what we must never try to do with COVID-19 is, when there are no resources, those organizations continue to do the work as civil society organizations. But when there are resources, you implement hit and run type of interventions that come to be delivered by messiahs who do not reside in those communities, whose relationship with those people is only to deliver whatever product or service they've been sent to deliver by government, and they leave those communities. That erodes the social capital that has been built in communities, which social capital is very resilient over time. Lastly, Chair, as we go down, in fact, as we went down the risk levels of COVID-19 from level 4 up to when we got to level 1 towards the end of 2020, the biggest mistake we made was to think that the West is behind us. And the single biggest mistake we committed as a society was not to invest on empowering people with the necessary skills such that they can coexist with the virus. We can no longer afford staying in our small cocoons. And so investments in life skills that will enable people to navigate and coexist with the virus is what is essential if we are to move forward now. And that public education and awareness can only be done through civil society that lives in communities. And that must come with the necessary support for implementation through resources, which is missing.
Thank you, Lerato. Just if I can request Minister Zulu and Minister Zweli, when I counted the hands, I stopped with Lerato and actually missed below the last 3 hands that we had and that were up. It is my fault. Which is Hope, Palesa, and Lerato Rampete. And these are the last 3 hands. Carol has spoken earlier. Lerato Mofokeng, quickly go ahead. Hope, and then Shaban and Lerato, and these are the last hands. Thank you.
Okay, thank you very much, Comrade Steve. Let me send my greetings to the Minister, both for Health and Social Development, as well as the colleagues who are part of this particular process. But let us also appreciate the effort that is being done by the South African government in terms of bringing the vaccine to the country and trying to ensure that they are saving lives. I'm speaking as a COVID survivor, as a person who tried traditional medicine, umhlonyan, and everything that you can think of, but I ended up being assisted by Western medicine. So we appreciate this particular process, especially as young people in this country. But over and above that, I would like the minister, when he responds, that he tackles this issue of traditional medicine, because it would seem that there is a feeling from the house that it's really assisting people to survive COVID. Meanwhile, we're seeing people dying every day. So I think we must try to dispel the myths and not run away from this particular issue, because I can see everyone is running away from it. And there's that notion that umhlonyan assists people. Meanwhile, people are dying in this country because of umhlonyan. Thank you, Chair.
Thank you. Hope?
Good evening, Chair. Can you hear me?
Yes, we can. Go ahead.
Okay, Chair. Mine is basically to thank the platform. I don't belong to any specific organization, but I grew up, I'm an advocate of NPOs. But for me, it's just to appreciate the platform and also the inputs. I'm sure both ministers present here must take to heart issues which have been raised here. The NPOs, the community-based organizations, need to be supported, not only during COVID-19, but throughout. And this can help people feel that government is responsive and working towards making sure that everyone is safe, everyone is alive, and people improve the qualities of their lives. Thank you very much.
Thank you. Thank you, Hope. Shaban? Sapnam?
Muted. Thank you very much, Sanbonani Nonke, All Protocol Observer. My name is Shabnam Palesa Mohammed, representing civil society advocacy group Sahari. South Africa has a right to ivermectin. Over 45,000 members, over 41,000 signatures supporting urgent access and rollout. Kabazela, I'm going to limit my question to just one. Dr. Andrew Hill from the World Health Organization last night in a public webinar said, if you roll out ivermectin too late, you could be a monster. Deny access to a life-saving drug. 4 to 6 weeks gives a window of opportunity to make a decision and order the drug or supplies will run out. Quoted again in Financial Times, the purpose of his report is to forewarn people that this is coming. Get prepared, get supplies, get ready to approve it. So my question is this.
Of course, you also said that demanding new clinical trials raises all sorts of questions about ethics and agenda. My question is this: is ivermectin being blocked because A, funding conflict of interest at SAPRA, B, we don't have the money because of corruption, or C, because ivermectin manufacturing and distribution tenders are being fought over? I thank you.
Lerato Rampetu is the last person. Thank you. That would be all.
Good day, everyone. Can you hear me?
Yes, go ahead.
Good day, everyone. And honorable ministers and chair, thanks for the opportunity. Just a couple of questions. The question that I have is that why is SAPRA silent on the use of methanol in hand sanitizers? Because what I've actually realized is that the symptoms that people are exhibiting, the COVID-19 symptoms, tends to actually coincide with those arising from methanol poisoning. And we know that in the United States, in New York City in particular, the government there has actually withdrawn methanol products that's actually contaminated with methanol. But in South Africa, SAPRA is silent about the presence of methanol in hand sanitizers. There's no ingredients on the bottles that are actually used in supermarkets everywhere else, where basically you have masses of our people going to the stores that basically indicate what are actually the ingredients in hand sanitizers. Now, my question is, are we sure that we are not being poisoned with methanol in hand sanitizers? And secondly, we know that when Minister Pravin Gordhan was Minister of Finance, he actually passed the sugar tax. And the sugar tax compelled companies to stop using sugar and replace sugar with aspartame. And we know that aspartame, when it gets in the body, it converts into methanol again. Now, we are dealing with the flu pandemic. And we know that these soft drinks, they also contribute to flu. Why is it that alcohol, which is basically beer, has been banned, yet we are having soft drinks which also contribute to the flu pandemic, yet they are not banned? The simple reason might be because we know that ethanol, which you find in alcoholic beverages, is actually an antidote to methanol poisoning. Now you have the same minister, Pravin Gordhan, which is a shareholder in Aspen Pharmaceuticals. And this is the company that's actually in a joint venture with Johnson & Johnson in the administration of, or the rollout of, the COVID-19 vaccine. Now we are having a case of ministers that are conflicted. And now we are expected that South Africans are expected to actually entrust these ministers with their lives. I say, not in hell. The other question is SAPRA. We know that SAPRA, in particular, is being funded by the Bill and Melinda Gates Foundation. Why is SAPRA allowed to adjudicate on the use of ivermectin when they are actually funded by vaccine suppliers, companies, multinational companies that will be supplying vaccines to South Africans? So I'm saying to the ministers, this is a political matter where politicians are selling the lives of South Africans for pieces of silver, and they must be stopped on their tracks. Thank you very much.
Thank you so much, Minister Zulu, Minister Mkhize. There are quite a lot of questions that were directed to yourselves, and many other questions that were even in the chat box, which I have requested that we look into that chat box. And I think some of these questions had to do with, you know, what we do to promote inclusive society, raise awareness, understanding of rights and needs of children and adults with disability. And I think this is from Natalie Johnson. And there were other questions which are critical, and I think that has to do with vaccine minister. I think all of these questions, they were stipulated in the chat box. And in fact, now the chat box is so long. But I know that both ministers were looking, and while they were listening very carefully. I think what is key is also around, you know, some of the donations that were done, when you take an example, which was done by Mzwandile Maile, the former hospital in Carltonville, and the costs that were included around the donation included also the 500 million, and it's still incomplete. What has happened in the situation of Carltonville Hospital? Other questions that also are related to Vexapra. South Africa has a right to Vaccination, and it's also on Facebook, and I think colleagues are sharing that. There are quite a lot. I'm not able at the moment to separate the questions from comments and discussions that are taking place. Minister, let me start quickly with Minister Mkhize and then Minister Zulu.
I thought it would be best if you started with me because Minister Mkhize's questions are quite a lot.
Okay, so we will summarize yours. Let's go with you, Minister Zulu, as a request.
I'm hoping Minister Mkhize, because I'm not necessarily just deciding that, I'm just thinking the number of questions to him were much, much more than the questions.
I agree with you, Minister. I think you should start.
Yeah, no, it's fine.
Okay. Thank you very much. Right from the onset, recall that I made a suggestion because I was foreseeing that we're going to end up with this situation because we are really a combination of everybody here. We are a combination of people that are NPOs or specialists in areas of social development and other issues, but also we are specialists and activists, if I may say, on your side, as people that deal directly with issues of health and so forth. At the onset, I did indicate that it might be a good idea for us because as we started, I was already seeing the questions that were coming through there and the comments that were coming through there. And I concluded there and then that we might not necessarily be able to adequately cover all the questions that have been asked here. To that effect, therefore, I even indicated that maybe what we might do, this committee of ours, we might put ourselves into working groups without losing sight of this collective. We might create some working groups that can be able to be focused in the issues that are being raised here. Because I'm not taking it that we are here on a platform of judgment or accusation or anything of that sort. I'm here because I know that I have to listen to some of the proposals that are being said here. I have to respond, obviously, to some of the questions, but I think we will not do justice in responding to all those questions. And therefore, my request, when I listen to all the people that are talking here, I can respond just to a few. Starting, for instance, with Tulani. I was really happy to hear what Tulani was saying. I hope it's the right one. When he was speaking about the social empowering of our people with the necessary skills and life skills and all that. And the NPOs that can be able to help us with the communication, education, and awareness, and I might add, even advocacy at this point. Now, imagine if we who are now dealing with that, and including, for instance, Betty, who spoke about the child protection and the fact that they've been offering a SASA with a free service point so that SASA can be able to assist and they can train volunteers and assist on online registration and all that. So I'm listening to some of this, and then Pelisa, for instance, speaks about issue of food parcel and the food being starch-based. And I'm saying, here comes my nightmare. One of the things that I've been saying to SASA is, who said our people must eat only the milli meal and the SAMP and the things that you put in there without giving them the choice, even in terms of isishebo, and then only giving them your baked beans and your tinned fish. So if we were to be able to have our own working group that can really be focused not only on just asking questions of what are you doing about that, And Bale talking about traditional medicines, yes, that's for the minister, but talking about NPO support on the model of cooperatives and helping our people in terms of self-help and taking responsibility as responsible citizens. These are some of the things that now are adding more to what I thought from the very beginning, that we need to create these working groups without bureaucratizing things. We create these groups, we have terms of reference, maybe how we must work because we are so diversified in our work here, but somewhere along the line, we converge in our work because the purpose of us being here really is to the service of our people. So I am making that suggestion in particular to say, I wouldn't mind personally as a Minister of Social Development and the department itself, as well as SASSA and NDA, to be part of a group, a working group that can really be able to focus here and see how do we work with each other, support each other, and work with each other. Because, for instance, when you talk about the NPOs, right on my arrival here, there was a conference on NPOs where we were talking about compliance, talking about budget, talking about a whole range of things. And we were in the middle of looking at what was agreed upon even at that conference. I was very new at the time when this conference happened. And of course, COVID-19 came, and I'm of the view that while COVID-19 stopped us from doing a number of things, or maybe stopped us from doing things in the traditional way, in the same old way, it has propelled us to look at doing things in a different way. So I'm sure that we can be able to work in that way. There was also, I can answer maybe a few of the questions that I think are very critical. To Betty, I would appreciate if we can get details from you, because I suspect, I'm not sure, you might be working with the region of Western Cape as far as SASSA is concerned. Maybe you can give us the details so that we can look at that, because let me tell you, there's absolutely no way that myself, my ministry, because it's me and the deputy minister, as well as the department and SASSA, should refuse to take opportunity like this when it is being offered to us, particularly because in the Western Cape, many of the service centers were closed. And I don't want to get into the politics about the closure and the opening and all, because some of our service centers had to be used for other purposes because of COVID-19. So I'd like to get the details so that I can then be able to engage with you outside of the meeting, as well as Monday, they spoke about community networks and all that. I think what would also be important for me is, as I said earlier, when I was seeing the comments and everything, I said it might be a good idea for the department to take some of those comments and begin to see how do we communicate, how do we respond back, not for purposes of question and answer, but purposes of how can we work with each other. And I know that also with regard to the service centers and all, there's been issues of what other service centers can we start using. And I know that because the churches are also here, we've spoken with SASSA about being able to use some of them. Some of them, they were approached, but obviously everyone is very scared of COVID-19 now. They want assurance that if we use their centers, the issues of PPEs and the issues of ensuring that we stick to the COVID-19 is done and done properly. We are very open to those opportunities. And then there was Oscar who asked us if we were to be able to meet, if we can commit to the meeting, THP sector. I think that I have Papi, who is also part of this meeting here. Papi will have to help me, and the other people who are here, I think, is Peter Nechipale. Those people the people who are with me from the department, they just need to take some of the people who are already saying, can we work with you? Can you meet with us? Can we work on that? Other issues related to NPOs and the fact that some NPOs feel excluded, and some NPOs feel that we are not listening to them. We have to work with NPOs. I don't know how many times really I have to just say it, that we have to work with NPOs. We have to empower NPOs also, because part of what is a question that was raised here, I think it's still by Tulani, with regard to NPOs who are not necessarily operating within our communities. I'll make a simple example and a quick one. I've been dealing with Khayelitsha in the past few weeks, Khayelitsha, Taiwan, as well as Masiphumelele. In Masiphumelele in particular, that's where I felt the pain, that the people of Masiphumelele have to go out of Masiphumelele to go and receive assistance from NPOs that are outside of the community, because the ones who are outside of the community, they have easy access in terms of communication and network and all. They have easy access, and they get support even from the banks. The banks, when I was there, I was told the bank is giving them 1 million and so forth. And I was saying to myself, I've got nothing against the NPO. All I'm saying, can we as a Department of Social Development and the National Development Agency, can we make sure that we look at empowering the NPOs that are within the communities, make sure that they are accountable, make sure that they are compliant, make sure that they get the people with the necessary skills to help them. But that does not exclude those NPOs that are very well established. And I like what Bale is saying also, because this is also an issue for us. Those NPOs that are, to a very large extent, are now very reliant on, are no longer relying that much on government, but they continue to be applying and all. It's important for us to see how we can be able to get people, even the NPOs, to be independent. Because when I say to you, we spent 7.6 billion, when I came here, it was a little bit less, but now it's 7.6 this year. Next year, the budget is 8 billion in support of NPOs. One would be saying, if government is spending that amount of money on NPOs that are closer to the people, the issue of empowering our people with skills and life skills, those are the NPOs who are supposed to help us using that financial muscle of government, but also going and looking at the public-private sector as support to see how they can also be supported. With regard to the basic income grant, I'm sure many of you are aware of the fact that this basic income grant, the development of the paper, the policy and everything was done long before I came here. It was finished as way back as 2002, 2004 with Prof. Taylor. What I did in asking the department, what else can we do being confronted by COVID-19? Because the president has announced that we have 350, but in my view, that 350 alone would not necessarily be adequate, looking at the time which also the president gave us. And the department said to me, by the way, Minister, there was something that we did here as a department, it's basic income grant. And I'm sure many would say, oh, how come you didn't know about basic income grant? The basic issue, the issue is that I was never in that space of social development, but I'm here now with the responsibility. I need to look at options. We've gone very far with the basic income grant plans. We've taken it to the ANC. They've adopted it at the National Executive Committee level. We are now having a committee that also includes civil society to be able to have a conversation about how to implement it. How creative can we be? How can we also deal with those who are saying, you are going to give basic income grant, then people are not going to want to work, people are lazy, which I really hate, because I don't think that is true. People of South Africa are confronted by poverty, unemployment, and inequality. They are still confronted by the inequalities of the past. And therefore, this basic income grant, I committed to bringing it back onto the table, and I've had good support for it. So I think you should just watch the space, because we'll do our best to continue in ensuring that people within even government itself, they appreciate it and they appreciate the impact that it can make, and it can even cover, in many instances, the people that are lost in between, those that are before a social grant and all. May I also answer the question about social grants? all the social grants that are normal social grants have continued to be paid in the same way that they were paid. Part of what is a problem for me that I started confronting even on arrival at this department was to say, we cannot live this way without giving our people dignity. Let us change the way we are working. Let us use technology to assist our people. And the 350 has clearly indicated to us, when you have 9 million people who can apply for the 350, it's clear that people can be able to use technology to apply for it, and we can process the applications without people having come to the offices of SASSA. 350, nobody came to the offices except for when they had to go to a post office to go and get their money, and that's where the problem is, where many of them are sleeping by the post office, and the conditions there are not very good, and that's what we are dealing with. That's why I'm saying the future must be based on technological solutions, finding solutions that make it easy for our people to access the services that we are giving them, bring the services closer to the people, which brings me to the fact that Sean was talking about the perpetuation of the country, and we've become a country of beggars. Sean, the issue of South Africa and why we are where we are today cannot be excluded from the point that it is not just social development alone that can be able to address the issues of poverty, unemployment, and inequality. The entire government needs to look at the well-being of its citizens through ensuring that education, health, transport, human settlement is all planned properly so that it can respond to these people. That is why, as a department, we're saying our responsibility is that of well-being of South Africans, but more so those that are vulnerable. So our approach is what Bale was actually saying earlier on, that while we're busy with the social grants and all, let us also look for ways and means of empowering our people. We cannot afford to create a country of beggars, but you cannot run away from the fact that the majority of Black people have never known anything else. It is only now that they slowly coming out, and then COVID-19 has even made the situation worse for them because they are dependent on jobs first and foremost, and the jobs are being lost now. So we have to work together to see what is it that we can do collectively. But I'm not saying that we shouldn't take responsibility where we have to take responsibility as a department. And Pastor Hlophe spoke about communication, education, and what is happening at the post office and all that. And I'm saying my thinking is that we have to put on our thinking caps and really find ways of bringing services closer to our people. People must not go and apply. Women with small children must not even go to the queue to go and apply. Their processing what they have to receive as mothers and their children must be done there, just like Home Affairs does in the hospital and all. But of course, when all that is said and done, there's also the other element of ensuring that the money that we give is money that is given to people who actually are supposed to get the money. So the processing thereof is important. Lastly, with regards to the issue of the disability grant, let us also separate between the temporary disability grant and the other disability grant, because we don't have a problem that much. We have a problem with the temporary disability grant because we extended it already twice. And then when the levels were going down, we thought, okay, now probably people are going to be able to go back and apply and do that. And then we went back to level 3. That created problems for us. But I have also publicly said, personally, I think in the areas where we've had problems, SASSA would have planned better. It doesn't have to take me as a minister to go all the way to Belleville. Yes, I have to go if there's a crisis, but crisis can be avoided if people who are working in the office are empowered already at a regional level to be able to take the right decision, so that in Belleville, when people can see that the queues are long, we need to get the chairs, we need to get the marshals, we need to get the volunteers to come in there on time. It mustn't be me that goes there to be telling them simple things like that. So it's my responsibility, the responsibility of the CEO. We must hold this and do it properly. And lastly, can I just clarify one thing? The language, suck it up, is not my language. I don't talk to people like that. I don't use that language. Least of all, I cannot use that language for our own people. And let me tell you, it is me that went and saw the poverty in the faces of the people that I found in Belleville. It is me that saw the people who were on wheelchairs, who, by the way, when I look at them, I see that it is beyond the issue of social grants that needs to assist them. It is the issue of us as government being responsible for them right where they live, long before they can even get to Belleville. And so, can people not use language that I can never use? I never said anybody must suck it up, because I think it was Tanya or somebody that said something like that. I'm not, I don't use that language. I'm clarifying it here that I can never say to anybody who is in a poverty-stricken place that they must suck it up. Lastly, it is me who also asked the police to stop spraying the people with water. And then you get people who are not there, who didn't see what happened. They calling me names, calling me a Madonna, calling me what. I climbed the truck of the police. I went in there because I did not have a loud hailer, which I have said to the department and SASSA. Every office of SASSA must have a loud hailer so that people can be able to be communicated to properly. All I was trying to do, after having been in the middle of that place with people, I mingled with the people, I pleaded with them. I only went up there because I was just merely asking, can I use it to communicate with the people? There's no way I can say people must be sprayed with water, being a Minister of Social Development. Thank you.
Thank you. Thank you, Minister. Minister Mkhize? And after your response, Bishop will summarize in terms of next steps.
Thank you very much, Steve. I tried to record the questions on the chat box, and then I continued when the questions were asked. I've got close to about 70 recorded. It's impossible that we could answer them all. Certainly not if I think we want to sleep this time, this side of 12 o'clock. So I'll try and touch on some of the issues. And I think let's start with some of the few key principles and principal issues so that we'll try and pick on some of the issues. First, let's deal with this gathering. We do appreciate that you have taken the time, and we basically believe that this kind of meeting should be able to help us to find a way forward. And in the way forward, we're looking at solving some of the issues that you've raised. Firstly, how do we keep in touch? Because the problem everyone is raising, it's very difficult to know who is NGO, who is an organization, NPO, anywhere, unless there's a way we can try and say those of us who have been in touch, let's then try and create that arrangement so that we're able to stay in touch. So I want to suggest that from the SANAC team using the platform, who could just make sure that all the people who are here were able to keep that line of contact so that we start from there, that if there's anything to discuss, we are able to reach to you. Secondly, we then need to also discuss the platforms of being able to share and receive information so that whatever information we're discussing, or what information we need, we've got a platform of where we could actually access that information. Thirdly, there are key issues that we have to kind of address. As we are talking here, we're obviously very diverse. We are talking about the need to address the concerns and the fears in society. we need to then look at what kind of programs do we see and what is it that we can do. We cannot promise that government will fund all of those programs, but let's start by saying that it's possible that there are certain resources that can be shared. For example, if we have to look at the messaging that we have to share, a number of people have spoken about sharing the information in partnership and giving to the constituencies and grassroots structures. So those issues, I think, are some of the things that we can deal with from this meeting. So then the issues that have been raised about the major issue here is kind of collaborating in the fight and spread of in the fight against COVID-19 and spread of information. I think we can do a lot of that, including us being able to relate together or meet regularly, whatever regular might mean, but to have a situation where we're able to sit and talk and look at how things are moving on. I think we can use the platform, the lessons from the SANAC approach, which we can actually use as a way of magnifying our response to the communities on the ground. Where we agree is that each one of you have got a role to play in reaching out to the communities out there, and in particular to share the information about the challenges of this particular pandemic. An issue has been raised about churches. The churches were not closed, but it's the gatherings, religious gatherings, that were restricted for a period. We have actually had a meeting with a large number of religious leaders convened by the presidency last week, and we discussed this issue. They raised a number of issues and concerns, and we did agree that a number of the issues, more than what has been raised here, have to be taken into consideration. Obviously, we thought that it would make much better sense to relook at the situation when the numbers get down. As we have seen that even with the schools, we have asked that there must be a delay. The numbers are pretty high and the level of infection is quite frightening at the moment. So it's important for us to deal with it. But to the extent to which there might have been an impression created that only the church is a source of infection, I think that needs to be corrected, because that's not the case. There are a number of areas which are basis of a super spread event, and we talk about it in that context, and therefore we would not want to create an impression that there's a specific targeting of the churches or places of worship as the only problem. I think it's important to say, even in those instances, there have been pictures of recent gatherings in places of worship where a large number of people, beyond a couple of hundreds, were actually without masks and not distancing whatsoever. Nevertheless, that's not the issue. The issue is that the malls, the queues, and so on, do predispose to the spread of the infection, and therefore we have to deal with those issues. There are challenges. I think you've probably heard the minister is explaining. There are challenges that have made it difficult to ensure that you can pay everybody online as quickly as we would have liked it to be. We have had lots of discussion about it. So that's the one other aspect which I'd like us to touch upon. Then we probably now need to deal with some of the specific questions. And in this case, we will just pick on those that I think are important. Let me start with the issue of the traditional health practitioners and traditional medicine. We actually work with associations of traditional health practitioners. Maybe our contact with them may not be, our program working with them may not be as good as what everyone would like it to be, But certainly there is that level of acknowledgement of the role of traditional healers. So I don't think that those who are saying that they are being oppressed by the ministry, those who are saying they've been ignored, are actually understanding that there is actually a working relationship. The question really might be as well, how far wide do those who represent, are they able to reach out? I now know that there has been challenges amongst the numbers of people that have been part of the traditional healing practitioners sector. There's been quite a lot of challenges in that sector. I think those are things that we need to deal with. But that's beyond the question of recognition. So that's part. It's not a new issue. In fact, recognition of traditional health practitioners is an old issue. It's beyond question at this point. The issues about traditional medicine, traditional remedies. Firstly, traditional remedies do not need any recommendation from government. They don't need any regulation from government because those generally tend to be used and people have used them. I mean, we're talking about all of the people are talking about Mhlonyana. Mhlonyana, you've got lots of herbs that we use and then people don't need any authorization from government for that. So we need to discuss what is it that we're talking about when we're talking about government having to use those or recognize those, because that's not really the issue. The issue is that, that actually they've been used continuously for many years. When I grew up, we used them, and today everyone uses Mhlonyana. There's no big deal about it. It's not the only one. There are a few other herbs that people use that we have known, and so you don't need a government authorization for that. Some of the medication is taken as food supplements, and some of those, again, don't actually need to go to SAPRA. What gets to be registered through SAPRA would be what is defined as a medicine, and therefore, in terms of the Act, therefore, has to go through a variety of processes to be registered. And Mhlonyana doesn't really belong to that group. However, there was an issue between us and Madagascar. They actually wanted us to assist them with the chemical analysis of the active pharmaceutical ingredient or medicinal content of Mhlonyana. And at the same time, they raised the issue with the Africa Center for Disease Control. And it was ultimately agreed that their process of analyzing their artisanal will be handled via the Africa Center for Disease Control. And we have actually offered that through our CSIR, we would be able to assist where requested. So until they come over to get additional support from our government, we would wait to get the response from there. So we have actually linked up with them at that kind of level. So insofar as we're going to need to deal with the traditional health practitioners, we have discussed the issue. We discussed it much earlier that we need to recognize the role that they play amongst the communities, that they are also similarly exposed to the risk of contracting infection. So those issues we have actually discussed. And so we probably need to just make sure that the discussions are widened so that everyone is able to be at the same level in terms of what discussions we've had and what needs to be done at a particular level. Then there's a huge discussion here about the issue of vaccines. Now, vaccines, there are those who need information so that the vaccines can be made, information can be made available, and we can work with those. But there are others who have got fundamental differences on the issues of vaccines. I think that needs a debate. There's not much we can go into at this point. I have a particular approach and a view, which is what we use to follow the current scientific advice that we use. So I don't think we want to delve into that particular debate because there is basically differences which are quite fundamental. And maybe we don't have space here to be arguing about the foundation of our own theoretical understanding as to what is it we're dealing with. So maybe we can leave that for another day. Then, so if we go through a number of, some of the people, for example, have raised the question of the safety of the vaccine. And the vaccines, as far as we are concerned, in the process of how they've been developed, the trials are also made to ensure that the safety can be assured, particularly to human consumption. So those safety issues have been dealt with. There are a number of observations that need to continue to be done to make sure that whoever gets a vaccine, if they develop side effects, they can be followed up so that those can be investigated. Now, the debate is quite high and also quite emotive. So we will have a system on our side to make sure that we have a record of those who might have any side effects. But side effects are not unusual, both from the point of view of vaccine. They're not very serious. They tend to be very minor, but nothing compared to what someone asked here about the messenger RNA technology, that it actually alters all the DNA of the individual. It basically stimulates the creation of antibodies against COVID-19. Is very specific to that. It's not something that will change all the genes of a human being. So there are things like those which we need to find a way to discuss so that we can come to a common understanding. Then the question of which companies we were negotiating with, those have been answered in the presentation. The involvement of community health workers, mine workers, all those are part of the groups that will be given attention to. So that I think is also taken into account. There are some material that the Department of Health has to share on the dispelling of the myths on the vaccines. It will work much better when we've got a coordinated platform so we can share some of that material. Then the issues of well, the one was about a specific issue of shortage of water in the Eastern Cape. I suppose that it's something that we can focus with if we can go into a bit of details and get more specifics about how we can link up with those particular communities. But during the difficult times of COVID in the first surge, we actually had the Department of Water and Sanitation working with communities and municipalities to deal with that problem of water. Then some of the questions, then there's an issue around the ivermectin. I will not go into lots of details about it because I don't think we want to be arguing about it, but just to indicate firstly that SAPRA does not pick the issue up from media and then take the particular drug and record it. There has to be a proper application process that goes to SAPRA. And secondly, in this case, there was a review of the various articles, including that one of Dr. Hill and a few others. At the time, this was done about 2 weeks ago. It was felt that of the articles that are available and those peer-reviewed, there wasn't adequate information to be able to ensure that SAPRA can safely say they can register the drug. So what SAPRA has then said we need to do is that we either go into the trials that are well designed scientifically, or we can get Section 21 applications where the doctors take responsibility. But this idea of saying we must just register doesn't work like that in terms of the processes. So the doctors can actually do the approach to SAPRA themselves, and then of course there's a whole lot of other processes that are going on. We've seen a number of experts talking about the issue of ivermectin, particularly some in the US and so on. When that discussion is happening, it's not adequate for purposes of registration. We need the processes to be done properly. So there's work, therefore, that we are doing to try and get that coordinated. That was what was given to the in the earlier presentation by Dr. Buthelezi, the DG, to just indicate that we're not sitting, but the way it is presented, it doesn't get presented in a way that you can actually get a registration. We need to find ways of then either waiting for those the results that will come from the various different countries, or actually we get a whole new team to review again this kind of issues. That's what we said. We'll put all of those we'll take all of those into account. But I don't think we need to abuse SAPRA and start accusing SAPRA of having received monies and therefore they are working for foreign agents of some sort. The Bill Gates donations are received and they are actually used in different parts of government, and not only just this country, many other countries, and they're not the only ones. There are many other foundations of families that we actually use in the programs. Some of the programs would be social programs, some others would be health-related programs. All of those programs, when we use those funds, there isn't anything that's basically, trying to fulfill the requirements or the nefarious ends of those who have donated. I think it's an abuse of an institution if we argue that way. Then the issue of arguing that there's a link between Aspen and Pravin Gordhan and so on, again, I think it's incorrect, and I don't think we must continue to argue things like that which are not true. And in this case, I think what we are discussing here is ivermectin. And we're simply saying ivermectin has been used in a different context. There's a lot of interest in using it to intervene and treat people on the COVID-19 situation. But we have not come to a point where there's general agreement right across, like the way all other medications get registered. As far as we're concerned, it's got nothing to do with who's got money and what the other pharmaceutical companies have to say. We've got nothing to do with that. All we have to do is to make sure that we review the available literature in such a way that we can actually stand in the event that there are negative effects that are associated with a registered drug. But you can't certainly turn around and say, well, we heard there was such a huge outcry, we registered the drug. We need to then say there is enough concern that's coming from the public, that many people are raising the issue. What are the other ways of trying to get to a point where the matter is resolved? And we can look at it like that. And we must accept that it's not just a controversy within South Africa, it's in different countries. So it's a genuine issue that there are different views about it. It's going to be resolved. I think we must give itself some time. It's going to be resolved, and therefore we can deal with it. There's quite a lot of emotions associated with it, quite justifiably, because people are dying. Everyone thinks that this is going to assist. But you see, there are many things that are making in assisting people, and therefore we need to just be sure that what we deal with, we must say there's scientific evidence of that, and therefore it's been peer reviewed properly, and we can deal with it in that regard. Then I think the concerns, the point that's been raised about ensuring that programs have got simplified messages that are going on to local communities and vernacular. That again, I think there's a good point there that we need to work on. And so some of the points that have been raised about how we can tighten up cooperation with various groups of NGOs and look at the rollout plan and make sure that civil society, participate in this program. We agree with those. The question of, I think it was raised by Harry Hausler around integrating TB treatment as well as the COVID interventions. I think it's very, very important. As we move on, there needs to be a way of adjusting in such a way that with time we'll get to a point where COVID is treated like any other disease and everything is integrated, so that we don't start losing people in terms of numbers of people who come for TB screening, TB testing and treatment and so on. So the follow-up, people are not lost into follow-up. So I think that's a very, very important point to deal with. Keke raised a question that she's been ignored and her letter and so on. Well, look, I don't remember the letter. I've not seen the letter. Unfortunately, this is a nickname, so I wouldn't even know what the real name is. So I've sent her a private message just to say, if she could resend that letter, let's look at it and see what assistance we can be of. Then at least with that direct email address, we'll be able to try and look at the letter, what happened to it. Then I think at this point, one should just I think hold it at that, because some of the questions were broad themes that I think were overlapping. Let's then say. Let's then say we thank everyone for all the questions that they've raised. I would like to suggest that, Steve, let's pick up this platform and not lose all the people who have contributed, because with all the issues, I mean, I've seen some of you have written very problematic comments on things here. I think we must try and be courteous to one another. It doesn't help to actually be as rude. I see some of the comments, I think they are not really acceptable. Nevertheless, the key issues amongst all of us here is that we are here because we want to do something for the community. We're already doing some work. All we're saying is that let's partner. And therefore, if we can find this platform that will keep us together, then we also focus on the key issues, which is all of us, everyone is concerned about it, and that is the COVID-19. I think that's a very, very good enough reason for us to keep together. And therefore, then we can structure the programs of what we can do together, and then we can look at what is there that can help to assist those. I mean, the point is made about all NPOs who need to be given assistance and so on and so on. Now that's for a fact, it's true. The extent to which that can be done is obviously limited by what resources are available, what we can do together. So from that point of view, I think this meeting has really been very helpful. We need to pick up the issues as we move on. There will obviously be more and more issues of what we need to do, that we need to get from your views, as well as also indicate new suggestions that have come onto the rollout strategy. Can we work together on all of that? Thank you very much.
No, thank you so much, Minister, and thank you for your responses, both Minister Zulu and Minister Mkhize. Without any waste of time, Bishop, your closing next steps in that. We have not lost Bishop.
Thank you for unmuting. Thank you very much. It has been a very live. We have noted a lot of the comments that have come in through the chats. We will make sure that we recognize and have them into the pool of ideas. I want to remind the meeting in gratitude that this meeting was convened by the Ministerial Advisory Committee. And we said that the primary concern that we have is that we need to find ways of garnering all the efforts of the various organizations that are many in this room that are doing a lot of amazing work in communities. But we're working in various diverse streams, and that if those can be brought together around one key thing, what is we call the COVID combat, and that we can then collaborate on that. There may be other things that are important to discuss and to raise. But I would like to suggest that those present today and those are not here today who would like to participate in an ongoing collaboration of information sharing and communication, creating a platform where we can have valid information, authenticated information that is useful to help us combat COVID. we would like to say that let's do that. We're going to ask the coalition that's been established at SANAC to continue to coordinate that, because, as I said at the beginning, the MEC is not in the business of organizing meetings such as this, but we will ask SANAC to do that, and we'll keep an interest in it because it enables us organizations the kind of advisories that will make sense for us to advise government. At this point, my appeal is that we walk away with a commitment to send our statement of interest to participate in an ongoing collaboration on information as well as communication against COVID, so that we can then create a platform that's going to be viable and that all of us know that we can co-own the information. And we would ask government to please bring their information into the same platform. We are dealing with issues of social development. We're also dealing with issues of health. And as much as possible, we'll try to make sure that the various areas of interest are taken care of as best as possible. This meeting has enabled us to at least find the space for communication, and we will build on this going forward. Thank you.
Thank you so much, Bishop. Let me take this opportunity again, to also express my appreciation, to MEC under your leadership, Bishop, because also what has been brought forward in terms of opening up the space for engagement is what we have called for, that it should not be limited to just platforms or structures that we are all used to, but to open up the space to more NGOs, more CBOs who can interact. Because when we speak about a collective challenge and collective response, it's exactly that is what is needed in championing change. I want to also express my appreciation, to Minister Mkhize, who eloquently also took time to respond to many of these questions that were put on the chat, as well as from participants who are members and leaders of civil society, as well as Minister Zulu, who also interacted, clarifying some of the issues, concerns, but also amplifying what the importance of supporting and strengthening civil society, which has been a clarion call made by many of the civil society. And I want to also say, I know Deputy Minister was here as well, and we appreciate his presence, having joined the conversation. We did have, as even the CEO of SANEC, Dr. Kulu, who was present here, the Director General of Health, Dr. Buthelezi, who also we had the privilege of having him as the CEO of SANEC. I want to also express my appreciation to all members of MEC, members of the Community Constituency Front, but all leaders and civil society representatives in diversity. We recognize the networks, the contributions that have been made, and the pockets of excellence that we see that contributes to the response. Ministers, I want to say, the campaign, that is calling on South Africans' responsibility. I am, you are, we are together, ending COVID, is actually what we all should be galvanizing in all the points that have been put forward really by leaders from various networks, to saying that we are one. We are one when we are accountable. We are one when we all reflect on the past experiences, what we've learned from HIV, what we've learned from TB, because those were work that were put forward, and we can actually champion things together multi-sectorally, but also supporting one another in those efforts. When we are all accountable, when we are all transparent in our effort, but also in building solidarity with civil society. Civil society is also overstretched, overwhelmed, and civil society depends on funding to continue its work in communities they operate in. So I'm really calling on all of us to really galvanize in efforts that brings all of us together. I want to also say, Minister, and I agree with you, this is not the end of it. We commit, to have this continuous engagement, and I want to also call that we engage with the MECs to have provincial engagements with civil society in provinces. And in this way, that will help us to amplify, clarify issues even at the grassroots level. And I really want to appreciate your time and your effort to sharing this space and informing members of civil society throughout. Colleagues, thank you so much. The comments, questions, again, will be shared with the departments. We will, of course, craft the responses and make sure that it's available, to all of you. We have your email addresses. We will communicate with you even in the next conversations. Thank you so much. You may have a good night or good morning.
Say good morning. Thank you.
Thank you. Bye-bye.
Thank you.
Bye.